this is Boston.
On the Gold Coast, German Shepherd Boston has been rushed into the Animal Emergency Service after his owner found him on the floor, unable to walk.
Hey, big man.
Vets Dr. Alex Hines and Dr. Gerardo Poli need to urgently find out what's wrong with this distressed shepherd.
Oh, you're a
The owners
fluffy
came
man.
home, or they were away last night, and they came back this morning and found out he couldn't really walk properly.
Oh, his breathing sounds a bit noisy too.
Yeah.
So just not walking properly, anything else?
Yeah, as far as I'm aware, I think they think it's a tick.
Okay. Paralysis ticks are so deadly because they inject a poison that causes widespread paralysis, not only of the back legs, but also of the breathing muscles, and that's life-threatening. I don't know how we would ever find a tick with all this hair.
Should be a prize for the person who wins, eh?
Who finds the tick?
Yeah.
Gosh, it's hard to even get your fingers down right down to his skin. Boston is showing all the signs of a patient severely affected by tick paralysis. Every breath is laboured, he can't stand, he's in real trouble.
If left untreated, tick paralysis can cause death in dogs in as little as 24 hours.
It's okay. Oh, it's okay. I know, so many hands over you, mate, so many hands. Just back, lots of pats.
I think I can feel something.
Oh, if you found that quick, you must have magic hands.
Oh, there we go. That's a pretty big tick there as well. Ouch.
Oh, it's still moving, its legs are moving.
Yeah. All right, to hold him still. Let me see if I can pull it out. This might hurt a little bit because his skin looks really sore around here. Good boy, Boston. Oh, God, this thing doesn't want to let go.
Danny, are you ready?
Yes. Oh, okay. Looks like maybe a little kitten or something in there.
Yes.
At the Kingston Vet Clinic in Melbourne, Nurse Jade has a surprise patient for Dr. Danny Dusek.
That's not a kitten. That's a very unusual looking kitten. Oh my God.
Would you like to meet her?
It's a snake. I was not expecting that.
This is my green tree python. Her name is Terry. She's 10 years old and I've had her for 5.
Hi, darling.
I think she likes you. She's a licker. She'll come up and she'll sniff you on the nose. Anytime I mention I have a pet snake, people take a step back, maybe even a meter. But having a pet snake is really rewarding for me. They're beautiful to look at and I can actually cuddle her and I feel like she cuddles me back.
So what's been going on with Terry?
She's got a few scales that are not quite right.
Yeah, a bit ouchy.
And Terry's also having a bit of trouble with her pooing.
So we've got quite a few little lesions under here, don't we?
Yeah.
It may be that she's got a bit of infection that's coming on now because it looks a little bit angrier than just a traumatic lesion.
Yep.
How long ago did she have her last shed?
Only about 2 weeks ago, so this is not normal.
Snakes shed their skin up to 4 times a year. As they grow, the old skin stretches and peels away, revealing new skin underneath.
On the underside of Terry's body, there's quite a number of lesions there. Snakes with lesions like this could have some infection going on.
As well as the nasty-looking lesions, Jade is also concerned about Terry's prolapsing cloaca, a single opening in reptiles that's used for both excreting waste and for reproduction.
When she poos, like not all the time, but about every second or third time, she'll get prolapse.
How much is prolapsing?
I'd say the most has been like a good 2 inches. I'm worried that if it happens and I'm not there to fix it, you know, what's going to happen to her?
Serious problems. Yeah, absolutely. Green tree pythons commonly get prolapsing cloacas, but it is still a problem. If that prolapse stays out for a significant period of time, that can lose the blood supply and potentially you need to surgically remove that segment, and that can be quite a life-threatening situation. I think the best thing would be to probably head over to an exotics vet where they can actually do some more advanced testing.
I don't know if she's in pain, but I just want her to be better. I love Terry a lot. To know that we can go to a specialist, have these tests taken and get the best for her, just like she was a pet cat or dog. But I feel nervous, anxious and worried, will she be okay?
That's a pretty big tick there. Ouch.
Back on the Gold Coast, Alex and Gerardo are trying to remove a deadly tick that has paralysed German Shepherd Boston.
Oh, God, this thing doesn't want to let go. Oh, I'm sorry, mate. Good boy.
Wow, it's amazing how something that small can have such a deadly impact.
Yeah, it's pretty incredible, isn't it?
He's such a big dog.
But that would be enough to cause the kind of paralysis that he's showing. I think he'd benefit from some sedation, wouldn't he?
Yeah.
He's just, even to help that upper airway breathing. Now that we've found the tick, it's vital that we get Boston onto some oxygen because I can see that he's already suffering from breathing paralysis. And then we can start the tick anti-serum. We're still going to have to clip all his hair off because we don't know that there's not another one there. But in the short term, he really needs the tick anti-serum because the toxin is circulating around his system at the moment. And the quicker we get the anti-serum on board, that will allow it to start neutralising the toxin. Come on through.
Before starting treatment, Alex is bringing through owners Rebecca, Wade and little Harlow to say goodbye to Boston.
You couldn't go and not say goodbye, I think, and especially for my little one. Got to give him love and stuff like that and make sure he's okay before we leave.
There he is.
It wouldn't be home without Boston. He makes our family whole. He's the best dog. He's just so good with our little one. She climbs all over him and he's just so patient with her and loves her. I feel like with dogs, when you look into the eyes, you can kind of see what's going on and he looks very sad, struggling.
He looks a bit sad.
He's a bit sad, yeah.
You want to give Boston a big cuddle?
Big cuddle and kissy, say goodbye.
Okay, guys. Say, see you soon, Boston. I really want to clip Boston's hair to be sure there are no other ticks, but he's too unstable. We're going to have to leave him for tonight, and tomorrow morning, hopefully he'll be well enough that we can do the clip.
Hey, what we got? I've got a guinea pig here, and I think there's something wrong with his mouth.
At the animal hospital in Perth, Sarah has brought in her pet guinea pig, Wolfgang.
He was drooling and doing strange movements with his mouth, so I took him in.
You got a sore little mouth.
He's really sort of chilled out. It's hard to tell if there's actually something wrong with him half the time because he's really easygoing.
Okay, hello, mate.
Sarah has brought Wolfgang to the right place, as Dr. Peter Ritchie has a particular passion for guinea pigs.
He is a cool little guinea pig with a pretty wicked haircut. Absolutely love guinea pigs. I have been showing and have owned cavies for 15 to 20 years now and have quite a few at home myself. I'm actually a guinea pig judge. I get flown around Australia and New Zealand to judge guinea pigs. How long have you had little Wolfgang for?
I think he's about 3 years old. I was always curious about guinea pigs when I was little. I didn't really want a big cat or a big dog. I just wanted something to pet and love.
Just having a look at his eyes and they're all looking bright and healthy. Having a little feel around his face and I can't really feel anything abnormal there, which is good. Heart and lungs sound all okay? Mm-hmm. Have you noticed him doing any funny movements with his mouth?
Yeah, I was noticing that today.
But we'll have a nice little gentle look there. First teeth we see are his incisors, which are the really long ones, and they actually look okay. It's the rest of his teeth that are the problem. He has another 16 teeth in his mouth that you cannot easily see. And we're just going to use this little speculum to shine a light in his mouth. You may not like this too much, but we'll have a... I know, buddy. Oh, it's a bit odd, isn't it?
Peter spots the problem immediately.
I can just see on the left-hand side he's got a spur, so one of his premolars is overgrowing in towards his tongue and has a little spike poking into his tongue. See on the bottom there, that hook? Yeah, see how it's growing over and towards his tongue? The reason that's happening is because guinea pigs, their teeth grow continuously all their life. It's about 3 millimetres a week. The way that they remove that tooth is by wearing it on the other tooth. So it's tooth on tooth rubbing together. When we're not doing that completely normally, then we start to get the teeth starting to overgrow. Diet is to blame usually in these cases. Guinea pigs are grazers. They're designed to eat grass, which is very tough and very fibrousy. In captivity, they tend to go for the things that are softer and easier to chew. The drooling is probably because there's a little bit of ulceration on his tongue and a little bit of pain.
Wolfgang has only a small spur, but it could cause serious complications if left untreated.
The worst case scenario is something that we would call tongue entrapment, so the teeth actually grow over the top of the tongue and entrap it below. I think at the moment, potentially what we would do with him is remove that spike that's poking into his tongue.
So would he have to have an anaesthetic?
Yes, for us to be able to get in there and grind those teeth down, we would have to give him an anaesthetic. It is very risky. Any anaesthetic holds a risk, and guinea pigs hold a much higher risk. All right, I'll take our little man out the back.
I'm a little bit nervous about the anaesthetic because he's pretty small. Hopefully he's going to be all right.
Come on, little mate.
I'm really worried about him, Jodie.
At the Animal Emergency Service on the Gold Coast, 4-year-old tick paralysis patient Boston has taken a turn for the worse.
We've given Boston sedation and that's helped, but his oxygen levels are dropping. I want to get the tick anti-serum on board, but at this stage, I have to get him stable. His oxygen levels are dangerously low. Come on, Mr. Boston. Hey. I'm becoming concerned that we're going to have to intubate him, take control of his airway and put him on life support. He's really gurgly. Just wondering if we even got to suction him, even in his mouth. Hear that? He's real gurgly. We try an oxygen mask, but Boston's fighting it. It feels claustrophobic. I know we're going to need to put a nasal line in if we're going to help him with his oxygen levels.
This is definitely better than him just having a mask in front of his face he doesn't tolerate. And it's much better than him breathing room air, so he needs this.
Boston's oxygen levels improve and we don't have to intubate. We're going to wait to clip the rest of Boston's coat. We know there was one tick, there could be more, but at the moment the priority is to get the tick anti-serum on board. Yep. Okay, that's running. Once that's into his bloodstream, neutralising the toxin, I'm hoping we'll get him to turn the corner. You can hear that noise that he's making. Each breath is taking extra effort, and that's a real worry. If his breathing slows down, then that's where we start to need to intervene, and we may even need to take over the work of breathing for him. Oh, mate. There's not a lot more I can do for Boston right now, but I am really worried. I'm going to be checking up through the night, and I can't help thinking about that family at home who are just hoping he's going to pull through this. It's touch and go.
All right, so he's getting sleepy. I'm just going to turn the gas down a little bit.
At the animal hospital, Peter is anaesthetising Wolfgang so he can remove a spur on the guinea pig's tooth that's causing pain.
Put that over his nose so I can have a look in his mouth. Just sneak in there and nibble that spur away. And that's it. I know, baby. Let's have a little look. All right.
Peter gives Wolfgang a quick injection for pain relief.
I know. There we go. That's all done. It's all done.
He's now ready to go home with Sarah.
Here we are. Welcome back. Would you like to take him?
Yeah.
So it's all gone really well. So he had the quick sedation, which he may be a little bit tired from that still, but he's recovered all okay. I've nibbled that spur away and it's completely gone now. And he has had an injection of this painkiller that I'm going to send him home with as well. I think you have caught this early, which is really good.
Really happy that everything turned out and hopefully he'll get back to his normal self. I can't wait to get him home and feed him a couple of treats.
There we go. Okay, good boy, Boston. Hey, it's quiet in here, mate.
At the Animal Emergency Service on the Gold Coast, Boston's condition has worsened. The German Shepherd is battling deadly tick paralysis, and Gerardo is deeply concerned.
Boston's pretty serious at the moment. So what's happened is the toxin has still had an effect, and the antiserum mops up the toxin in the bloodstream, but there's still toxin bound to his nerves, and that's his own immune system will have to get rid of that over time. So generally what happens is a little bit of a deterioration over the next sort of 6 to 12 hours, and he's kind of deteriorated quite rapidly.
Boston has been transferred to the intensive care unit as his condition is now critical.
The nursing care is a bit more intensive, so hopefully that's enough to keep him stable, keep him comfortable, so we don't have to progress his care into mechanical life support.
Hopefully we can get some answers for little Terry today.
Yeah, I really hope so.
Yeah.
In Melbourne, Danny and vet nurse Jade have arrived at the Bird and Exotic Animal Clinic, hoping to find out why pet snake Terry is unwell.
I'm a bit nervous.
Oh, you'll be all right. So today we really want to find out what's going on with Terry as far as the prolapsing cloaca, but more seriously, those skin lesions on her underside.
Hi Danny, how are you going?
Jacqueline, how are you?
Wonderful to see you.
You too.
And this is Jade and Terry.
Terry has been booked in to see Exotics vet, Dr. Jacqueline Gatt.
I'm the one that gets to see sick and injured wildlife and birds, rabbits, guinea pigs, lizards, snakes, turtles, all the weird and wonderful pets, and give them the care and medical attention that they need. So tell me a little bit about what you're concerned about, Jade.
On her underside, you can see she's got multiple of these. That's probably, I think, the worst one.
Yeah, these are a worry, these spots. And tell me about the cloaca.
Usually only when she poos.
Okay.
It comes out.
We never want to have our insides on our outside. That's just not where they go.
Oh, there it goes.
Suddenly, Terry provides Jacqueline with a worrying clue as to what might be wrong.
That's not normal. So this yellow goo is not the sort of typical colour of their droppings. This is more the colour I would expect from something from the reproductive tract. As a 10-year-old girl, she's in prime breeding age. Sometimes we can have disorders or diseases going on where the eggs aren't forming properly, and that can be passed through the cloaca. So certainly that could be, one of the possible reasons that she's having these issues. I'm worried about internal diseases that can show themselves on the outside, like kidney failure.
Okay.
Worst case, we could be dealing with a cancer of some sort here. Snakes are masters of disguise. They don't want you to know that they're not healthy. So by the time we can see that something's going on, things are getting serious. I know that's a really scary thing to think about, but we're going to get as much information as we can, and the more we know, the more chance there is we can come up with a plan to give Terry the best quality of life.
This news has shaken me up a little bit. I came in hoping that it was just going to be something simple. It could be a cancer.
X-rays and blood tests are now needed to find out what's wrong with Terry.
I know how much Terry means to Jade, so I'm just really hoping that what we find isn't anything too serious, because that would just be heartbreaking.
In Collaroy, wildlife volunteer Tony has brought in an intriguing bundle for Dr. Lewis to check.
Hey, sweetie.
Hi, Tony.
Hi.
What have you got there?
I've got you a surprise.
Come through. I like the little pillowcase for matching today.
Yeah.
Tony's a real character. My first thought when I saw that pink squirming parcel was, no, Tony, you haven't brought me a snake, have you?
No snake. Nothing that should bite you.
Okay, let's have a little look. Oh, you're a bit shy, mate, hey? These guys are amazing, gorgeous little kangaroo Joey. Absolutely beautiful little thing. Where did you get this little fella from?
Okay, he's come from the south coast where we think his mum has been hit by a car. And he's my first Joey to babysit and hopefully introduced to the world.
Very good. And have we got a little name yet?
Yeah, his name is Logan.
Oh, hello, Logan.
Logan is an eastern grey kangaroo. The fragile little orphan needs to be nursed through his first few crucial months if he's to have any chance of being released back into the wild.
We brought Logan in for a weight check today, making sure we've got our milk qualities right, and just an over health check as well.
How long have you had him for?
I've had him since Saturday afternoon.
And how's he going with being bottle fed?
Really good. Sometimes he'll fall asleep, so I'll have to wake him up. But otherwise, no, he's taken to the bottle very, very nicely. But I just thought I'd make sure we're feeding him enough.
Absolutely, yeah. So we'll give him a little check over, make sure everything looks okay. Unfortunately, at this sort of age, they are vulnerable to diseases and prone to dehydration, so we've got to make sure they're getting enough to drink and make sure he doesn't get any sort of, common infections or anything like that.
All right, we better get some sedation for Miss Terry.
In Melbourne, Danny and exotic animal expert Jacqueline are about to examine 10-year-old Terry.
If you're happy to pop that injection in.
Sorry, my love. Just a little sting for you, okay?
Yeah.
The green tree python has a prolapsing cloaca and lesions on her underside, and x-rays are needed to find out why.
Sedating a snake is very different to sedating a dog or a cat. A lot of the signs that we look at in dogs and cats you don't get with a snake, so it's important that we are monitoring those vital signs.
We're going to get a little probe on here and see if we can't have a listen to her heart.
I want to hear that whoosh whoosh. Perfect.
And sleeping happily. Now that Terry's asleep, I'm going to make the most of this and we're going to have a really good look over her. Just really checking for lumps and bumps or, anything that doesn't feel quite normal. Having a look over at Terry's cloaca, it all looks pretty nice and normal from the outside, but that doesn't always mean that things are okay on the inside. As I'm working my way down, I can feel that things towards the back part are not quite right. So if you have a feel just here, it's quite thickened. There's quite a solid...
Yeah, I really can feel that. So those lumps and bumps feel quite firm and mobile. We certainly don't know at this stage what they are, so we need to do a bit more investigation to find out. Let's take you through to X-ray. Terry, hey?
In reception, devoted owner Jade is anxiously awaiting news.
I love Terry so much. I can't bear to think that she's in pain or that there's anything terrible happening to her. So it's a nervous wait ahead for me today.
X-ray.
I'm feeling really nervous and I'm just crossing all my fingers that nothing bad comes up on those X-rays.
That's a little more than I was expecting to find. Very, very worrying.
There you go. Alrighty.
Dr. Lewis is performing a health check on Logan, an orphan infant eastern grey kangaroo.
Amazing little creatures, aren't they?
He's got a bit of dry skin. I think that's where he might have rolled onto the road.
Logan was rescued after his mother was hit and killed by a car.
No actual wounds, a little bit of dry skin, a little bit of abrasion. Wow, look at those legs, aren't they incredible, eh? All the power comes from those back legs, Les, and then the balance obviously comes from their long tail. Logan's been in his mother's pouch for probably close to 6 months now, and that whole world has changed in the last 2 to 3 days. Let's get you back in there. We don't want to get you too stressed, sweetheart.
When you're ready.
Yep, there we go. 1.2 kilos. Fantastic. Now, what did you pick him up?
He would have been 1.4 when I picked him up.
Logan's weight is down a little bit, but that is to be expected. That first 2 or 3 days in a new carer, he hasn't lost too much, but change in environment, a change in food, all these factors are very stressful. So the fact he's only lost 200 grams is actually a good sign.
With a health check complete, it's now up to Tony to bottle feed the little kangaroo for the next 6 months.
Hope for Logan, for him to go back down to the south coast with a mob of other eastern greys and be released and become a real Joey and forget about us.
We're just going to wrap you up again. He looks fit, he looks strong, no obvious injuries, so I would be hopeful that he will grow up to the point where we can re-release him.
He's got another 3 hours before he has to be fed, so...
All right, there we go. I'm going to give you over to Tony, the expert. To sort of see him, pop out of that pillowcase was special little moment in my day.
Thank you.
There you go.
So these lumpy bumpies do not like.
At the Bird and Exotic Animal Clinic in Melbourne, Danny and Jacqueline have spotted something worrying on the x-rays of 10-year-old tree python Terry.
What would you normally see there?
So we should be seeing a bit more smoothed-edged organs.
So what we're seeing here now on the x-ray could explain why we're seeing those skin lesions too.
Yeah, absolutely. This might be the first sign that there's something internal going on. The biggest concern now from these x-rays is that we could be looking at cancer. It could be as simple as an infection or an abscess, but cancer's definitely the big scary on the cards. I think our next plan of attack is going to be to get a blood test and see if we can narrow down what part of Terry's system is involved in these changes. Oh, perfect, hold that off.
The blood will be sent to the lab for analysis, and the results should be back within 24 hours.
Okay.
Owner Jade is anxious to hear what Danny and Jacqueline have found so far.
Terry's waking up a bit here.
All right.
Now, we took the opportunity to obviously look at all of Terry, including her insides on the x-ray.
Yeah.
And unfortunately, there are some kind of lumpy, bumpy changes. So what that means is that we've got something more serious going on.
Jade is incredible. She is so strong and brave.
I wasn't expecting that. We're not going to give up on you, Terry, all right? So I just got to await some test results for her blood, and hopefully that will give us a more definitive answer to which pathway we go from here, if she needs surgery or if she needs medication. If the best thing for her is going to sleep, then, I have to consider that. Yeah, Terry means the world to me, so I just wanted to be all right.
Oh, Boston.
At the Animal Emergency Service on the Gold Coast, German Shepherd Boston's condition has continued to deteriorate.
You're really paralysed now. What happened? It all just went downhill. Your family is going to be so worried about you. We knew that this could happen, Boston, hey, but I was really hoping it wouldn't. But you definitely are worse than yesterday.
Alex fears the poison from a deadly paralysis tick may have done too much damage before the antivenom could take effect.
He's now got 2 oxygen lines in. He's definitely still putting a lot of effort into breathing. We're worried about what we can hear on his chest sounds, and we think he might have aspirated, so we think he's developed pneumonia. So we're going to want to take some chest x-rays, and then we'll know how bad this is. Good boy. In we go, Boston. Good boy. It's okay.
Okay, big fella. All right, we're ready. You all right?
Boston's x-ray, it doesn't look very good at all. What I'm seeing is almost complete consolidation of the lung. This is pneumonia on a massive scale. This has added a whole level of complexity to Boston's condition. It means that not only is he dealing with the tick paralysis, but he's got a severe pneumonia, and this could be the part that's life-threatening now.
Hi guys. Hi Jade. Danny's already here, so shall we get straight to it?
Yeah, sure.
All right, let's go.
At the Bird and Exotic Animal Clinic in Melbourne, Jade has returned with Terry for more investigation of the cause of her nasty skin lesions.
Blood result is quite inconclusive, so that means that today we're going to have to open her up and see what it actually looks like on the inside, and hopefully Jackie can decide what we're going to do from there.
This is my first ever snake surgery. I've never been part of one before, so it's going to be really exciting.
Recent graduate vet Danny is keen to assist with Terry's surgery.
My history with snakes up until now is Terry, so it's all very new and it's a steep learning curve, but it's really exciting and really interesting.
So we've sort of pre-measured along Terry to see that the lumpy, bumpy soft tissue structures we were seeing on that x-ray, making sure that those actually match up over here to where we're going in to have a look. All right. I think we've found the problem of why poor Terry is feeling as she is. This is a very ugly, unhappy ovary. That's a huge surprise. I didn't expect there to be this many or such big, hard, abnormal-looking follicles floating around inside her. We're going to have to de-sex her, removing as much of this diseased, abnormal ovary as we can. See if we can't make Terry feel better. Ovary removal is relatively common in certainly reptiles. It does happen in snakes, but it's not a routine thing like it is in dogs or cats for preventative health reasons.
Do you think the problem's confined solely to the reproductive tract at this stage?
Look, I think most likely it is. I'm pretty suspicious that this is our major problem and what we're seeing on the X-ray. So at least we've, found the source of the issue. We're on the home straight. We've got kind of one half out, that little bit there.
But suddenly, there's a problem.
Her heart rate's just become irregular and dropped quite suddenly. Can you grab the crash kit, Danny? So we're going to give her some drugs to help keep that heart rate up. This drop in heart rate is definitely not what we want for Terry. We need to act quickly or we could lose her. The longer we're here, the more risk there is of that heart.
Yeah, sorry mate, you're gonna lose all of that beautiful hair.
Buzz buddy.
With paralysis tick patient Boston's health deteriorating, the decision is made for vet Elise and vet nurse Natalie to go ahead with clipping his fur in search of further ticks.
Poor Boston, he's now got paralysis and pneumonia. We've started antibiotics for the pneumonia, but the next step is to clip this hair off. We've got to make sure there's no more ticks.
I'm amazed that they found the first tick under all this hair.
Boston is now at the stage where he's completely paralysed in his body. He can lift his head, look around a little bit, but that's about all he can do. What that means is we have to help him with all his bodily functions. He can't even go to the toilet on his own. So we're going to need to put a urinary catheter in. We have to put cream in his eyes because his blinking is affected. All these things become paralysed as part of the condition. I'm worried there could be another tick there. 10% of patients have a second tick, and if he has a second tick somewhere hiding in this big furry coat, then it will kill him.
Boston's owners, Beck and Wade, have come for a visit, desperate to see their sick boy. But a decision has been made to keep them at a distance.
It's extremely hard for owners not to be able to come in and visit when they have tick paralysis, but we have seen animals before, like Boston, that are just coping okay on their own, that when they see their owners, they get so excited and their bodies just can't cope with that extra bit of stress. So, yeah, you always think they're going to be so much better coming in and seeing you, but actually in this case, it can be really dangerous for them.
He's getting all his hair off.
Poor thing.
Yeah.
He looks so sad.
Yeah.
So we were obviously just hoping to go see him and just give him a cuddle, make sure that he was doing okay and to reassure that we're still here and, hoping for the best for him sort of thing. And didn't know really what to expect. We got lots of phone calls last night, which was really good. Just kept us, in the lurk and know what was going on. So, we just wanted to see an improvement. So what sort of journey do you think he's going to be on?
The pneumonia, to be honest, has set him back a little bit.
Okay.
Yeah. Because it's just given him another thing to fight.
Okay.
So it really is a matter of just watch and wait a little bit. There's only so much we can do for him, do you know what I mean?
Yeah.
And a lot of it's going to be up to Boston to fight this.
I feel very nervous, constantly just anxious, because we just don't know what's going to happen, because obviously he's got pneumonia as well. So he's got an extra thing he needs to fight and get through. So Boston's not out of the woods. It's sort of touch and go.
The clip is over. It was a marathon effort, but well worth it.
And we're done. Good
boy. No more hair for you. And we didn't find a second tick?
No, we didn't find any additional ticks.
Okay. I feel much better now the hair's off. We know for sure it's just that one tick that was causing the problem. So I think at this stage, we've really done everything we can for him. He's had his clip, he's had his tick anti-serum. It's really up to Boston now to fight this and get better and get home.
Yeah.
Can you grab the crush kit, Danny? Give her some glycopyrrolate and try and get that heart rate back up.
In Melbourne, Terry the snake's heart rate has dropped dangerously in the middle of her operation.
So we're halfway through surgery and Terry decides to crash. Heart rate starts to drop and we need to administer life-saving drugs straight away.
Give her the glyco.
With Danny assisting, exotics expert Jacqueline is in the middle of desexing Terry after discovering the pet snake has diseased ovaries.
All right, so our heart rate's back up and stabilised now. So that's a much happier sound. Geez, Terry, way to give us a bit of a scare, my darling. All right, yeah, so that is our big bad.
Whoa.
Found this 15 centimetre long, 3 centimetre wide, strange object. I thought it was going to be attached to things, but it came right out in my hand. And as it turns out, it's made up of a whole lot of abnormal follicles, and now I'm starting to understand why Terry's been as sick as she has been. We'll know more once we get the pathology back, but reptiles being great at, walling off infections, Terry's just dealt with it in her own way and got on with life, whereas you and I would not have been quite so laid back about it.
Poor Terry must have felt absolutely disgusting having that sitting inside of her. The fact that it's huge would have been obstructing and putting pressure on all her other organ systems. So it would have been awful. So I'm so glad we've been able to get that out today. Poor Terry with all of that inside your body. I don't know how she's coped so well.
No, I really don't. Reptiles, they're amazing, amazing animals.
Absolutely.
We've found the cause of Terry's issues. We've solved this puzzle.
Surgery complete, Jade comes in to find out what was inside Terry.
So would you like to see what we found?
Sure.
Alrighty.
Okay.
But here we have...
Wow.
These are a whole lot of basically egg yolks that have gone rotten on the inside of her. And then all of these really hard, abnormal looking follicles are little egg yolks that never became an egg. She's only this round. This has been sitting up against her gut, and so every time she would have tried to eat, she would have been getting this pressing against her.
Yeah.
And as for our cloacal prolapse, I suspect that she was straining harder than usual to pass her poo because this was probably in the way, making her feel like she had to push more.
And so is this the cause of those sores that she had on her belly?
What I think has probably happened is that some of these more conjoined ones have ruptured, and so the body's then had a reaction to that. Probably some bacteria has been released into her bloodstream, and so then you've had all that inflammation in the narrow little blood vessels under her belly. So we'll get those off to the pathologist because there's still some tissues in there that we want to find out whether or not there was a cancerous process that started all this off in the first place.
Thank you so much. She means the world to me. I'm really hoping that she comes home and that she comes up well from this, and it's all positives from here. All right, we'll see you at home in a couple of days, all right? But I'm still concerned. It looked pretty terrible in there. Seeing how diseased that tissue was inside of her, that I can imagine that she was in pain.
Hey, Boston. How are you doing this morning? You're still on your oxygen by the look of it.
On the Gold Coast, tick paralysis patient Boston is still in intensive care, and Alex can't relax just yet.
It's been 2 days since Boston came into intensive care. It's good to see that the paralysis is wearing off, but the pneumonia, it still has him in the danger zone. That breathing still sounds a bit rough, hey, mate? Hey, you just look tired. How are you going with your walking? I just wonder if we might give you a little bit of a trial around and see if you can get up and about. He's blinking, and he wasn't able to blink when he first came through into the ICU. So those things, as they improve, they tell us that it's less the paralysis that's holding him back at the moment and more the pneumonia. You gonna show me what you can do? You can come for a little walk? Come on. Good boy. That was really good. Hey, take it slow. Oh, you're off. That's great. Good job, Boston. Yeah, there's not much of you under there. Now you've got no fur. Oh, no, don't go check out the other patients. If you're walking that well, you might even be up for some food pretty soon. Good boy. may not seem like a good thing to see a dog wee inside, but this is really good for Boston. It's an important step in the recovery of tick paralysis because it really shows us that the paralysis is starting to wear off and he's able to resume those normal bodily functions on his own. So good on Boston for having a wee. Is that your bit of exercise for today? Do you want to hop back into bed? I think you'd be better off in bed. Good boy. You sit down. Oh, yeah. I know. Get you connected to your oxygen again. I can't even think about Boston going home until he's off the oxygen and breathing on his own. Right now, he's a long way from that.
A few days after Snake Terry underwent surgery, Jade meets up with Danny after receiving some bad news.
It was all looking so positive after surgery. She'd recovered quite well initially, waking up from anaesthetic, but I think it was such an extensive procedure, she's just not been able to fight to the end. I think it's just been too big a procedure for her to handle.
Poor little thing didn't make it through the night.
Jade is coping bravely with the news and trying to focus on the good times with her much-loved Snake.
I've got some photos I really want to show you.
Oh, you're kidding? Got him here. Oh my God. Look at her. Hello. Oh, Terry. Gosh, look at the colours. She's just beautiful.
And that was her birthday.
I love this one with her little party hat.
Got it on her head.
Aww. Thank you for showing me the photos. They're beautiful.
Something I'll never forget of Terry is when I would get her out, she would first slither around me and then she would come up and she would touch her nose to my nose. She would lick my nose and then she would come up and sit on my head. And that was a very common thing she would do when I got her out. And yeah, it's I don't know if it was a kiss, but I took it as a kiss. It was lovely.
And she'll be very missed. You're feeling much better now, aren't you, Boston? Hey, you're such a good boy. Hey, you want to go home today? That'll be pretty exciting. You're going to see your family again. Good boy, yeah.
It's been 5 days since German Shepherd Boston was bitten by a deadly paralysis tick and left fighting for life. After a week in intensive care, he's finally on the mend.
Hey, how's it going?
Hey, yeah, really well. He is doing fantastic.
So what's the verdict? Do you think he's good enough to go home?
Yeah, I think he's ready to come home. He is off oxygen, he's had some dinner, and he's up and walking around.
That's so good.
Hey, Boston. Hey?
Are you a good boy? Thank you. Thank you, buddy.
I am so thrilled that Boston is going home today. There were moments where I wasn't sure if he was going to survive, and just being able to take him out to his family, this is going to be incredible.
Hello. Hi.
Does he look a bit different?
Yeah, he looks a lot different.
He's so different.
Buddy.
Oh, boy.
Hey, buddy.
Yeah, what do you think, Harlow? Did you still know it was Boston?
Do you know it's Boston?
Hello, boy.
Oh, that's honestly, that's the happiest he's
He looked a bit unsure. He was like, oh, hello.
Hey, boy. There's a boy. Okay.
He looks so different.
But he's still our baby.
Yeah.
It can be really tough as an emergency vet. It's long hours, it's tough work, there's big decisions to be made. But seeing patients like Boston go home today, it's so worthwhile. This is why we do it.
Can you be a good boy?
Are you going to take him out? Yeah, he's not going to be...
Not that way.
This way, Baba.
Boston, come on. Let's go, boy.
Yeah.
You hold on tight.
I took him for a walk last night and basically then he's been really sick this morning, so I was kind of worried straight away and thought he'd need some kind of injection or pills.
Gary! What's happened to you, Gary?
He's been really sick today. I woke up this morning and he's vomited all over the living room about 4 times.
Oh, no.
Yeah. He doesn't want to walk.
Gary is definitely not looking like a happy dog. It means that we have to investigate. We need to go and find out what's actually going wrong with Gary's tummy. You've got to feel sorry for the little guy. So tell me, what's been going on?
He won't eat, he won't drink and do anything.
And the vomit, is there food in the vomit or is it just...
There was 2 mounds of vomit, which looked like Weetabix.
Like Weet-Bix, you eat for breakfast Weet-Bix?
Weet-Bix, yeah.
Right.
Gary and Anna moved from the UK to Australia just 2 months ago.
You're an English dog, all the way from England.
Yeah. He's like my son, has travelled around the world with me, so it's been quite a little journey.
Now you're a Bondi dog.
Yeah, now he's a Bondi babe.
Can you think of anything that he might have eaten out of the ordinary?
Yeah, we went for a walk on the beach. I did notice that he had found like an ice cream tub.
Like on the sand?
On the sand, yeah.
Right, okay. That's not good. Your first day at the beach. I've never met a Dachshund that doesn't love to eat. And those guys will literally, nose on the ground, will eat anything that they possibly can get their hands on. We could be dealing with some kind of horrible bacteria, or it could be something as serious as having an obstruction. What we need to do as a matter of priority is figure out what else is going on here. He's really dehydrated, so I'm going to put an IV in just so we can get some fluid into him, and we'll take it from there.
I'm really, really worried about Gary, and I don't really know what's going to happen. You're a good boy. Love you. Thank you.
See you, Anna.
See you later.
Speak to you soon.
Okay. He's never been this sick before, ever. And I'm really worried.
If we're dealing with something serious, it may be that Gary actually has to have some surgery. He's so sick. Yeah, you're all right, mate.
Come on, girlfriend.
Up on the Gold Coast at the Animal Emergency Service, Marie has arrived with her heavily pregnant golden retriever, Greta.
Good girl. Come on. Greta is fun-loving. She is the light of my life. So I'm coming in today to get Alex to have a look.
Here she is.
Good girl.
She's looking ready.
Very pregnant.
Isn't she?
For emergency specialist Dr. Alex Hines, cases like this are why she wanted to become a vet in the first place.
I love my work and I love what I do. This is more than a job. This is my way of making a difference in the world. I think for me, because I'd been around animals all of my life, it was a decision fairly early on that I wanted to work with animals.
You're looking wonderful, aren't you?
Glowing, I think would be the way you put it.
Oh.
Alex needs to determine exactly how many puppies they could be dealing with.
All ready to pop those pups out? I wonder how many you've got in there.
When dogs have puppies, there are a number of things that can go wrong, which is why we do X-ray and ultrasound.
Come on, let's go. Good girl. My dog's not going up there unless the table's clean.
What are you
Has
doing?
to be clean for my girl to get up there.
Marie isn't just a client, she also works with Alex.
She's the kennel attendant in our hospital, which means she pretty much cleans this whole place.
All done.
We call her Nana Marie because she really is like our Nana.
Hey Greta, how you going?
Gerardo, he is my life partner, but he's also my partner in the hospital. Greta, come over here.
Come, Greta.
And he's very helpful when it comes to heavy lifting.
Oh, big girl.
Good girl. So how many puppies do you think she's got in there, Marie?
I think around about 10.
I'm going to go with 12.
You're going with 12?
Yeah. We'll see. Let's see. 8, 10, 12. It's always a bit of a guessing game as to how many puppies are in there.
You ready, sweetie? I'm just going to roll you over, Greta. Good girl, good girl. There you go.
That's my girl.
Ready, team?
I think we've pretty much got all of her in.
Okay, I'll press the button. 1, 2, 3. Find out if I'm the winner.
Look at that.
Whoa.
Look at them all. Wow.
There's a lot of babies.
Look how crowded they are. There's not room for all. They must be fighting for space.
With the X-ray showing multiple puppies overlapping, Alex is concerned some might not be getting enough oxygen or could be crushed.
When you've got that many puppies that are all jammed inside a confined space, there's a lot of things that could go wrong. Literally filling all of her belly there.
You got a sore tummy, mate. I know you got a sore tum. Let's just take a quick temperature.
Back in Bondi, Kate and vet nurse Fran are trying to figure out the exact cause of Gary's severe vomiting.
It's okay.
The only clue from his owner, Anna, is that he ate some ice cream off the sand during a walk at the beach.
Bit high. Let's have a feel of his tummy. We know that he's a scavenger. He's a Dachshund. I mean, this could be anything. Definitely got something in there. What is that? Franny, I don't think this is ice cream.
What have you eaten, huh?
Feeling Gary's tummy, you can feel a mass. There's something in that stomach. Let's get him on some pain relief and let's get an x-ray. Let's go find out what's going on.
Sounds good.
At its very worst, this could be serious obstruction. This may be something that we end up having to go in surgically to fix. And if that's the case, this is pretty bad for Gary. Okay, ready, Franny?
X-rays.
Wow, this is not what I expected. Looking at these x-rays, I can see straight away what Gary's problem is here. So this is what we could feel when we felt that tummy. And that could be really serious for Gary.
Lots of others there, darling. Your work is about to start. And yes, you're a good girl.
On the Gold Coast, heavily pregnant Greta has been x-rayed. Owner Marie and vets Alex and Gerardo want to settle a bet and find out how many puppies there are.
Here we go. 1, 2, 3.
We've taken the x-rays and guess what?
10, 11.
Really?
12.
There's 12 puppies in there.
Alex has won the bet, but now must investigate the possible complications of such a large litter.
All right, let's take her through. We know where any pregnancy comes with its set of risks. She's got 12 puppies that she needs to push out, and she may just become exhausted and not be able to deliver all those puppies herself. If at any stage we feel like she's in trouble, then we would have to discuss about whether we would need to take her to surgery to do a cesarean.
The health of each pup is also critical, so Alex must now perform a vital examination.
Ultrasound will allow us to see how healthy the puppies are. So we'll be looking for the heart rates of the puppies, and that'll help to tell us whether they're in any distress or not. So there's the heart beating.
The heart rate for this particular puppy is 185 beats a minute. It's a perfect little puppy heart.
It is crowded in there, isn't it? I don't think anyone wants to be that close to their brothers and sisters.
So is it possible, because there's so many puppies crammed in there, that we could be coming into some trouble?
That is possible. When you have that many puppies in there all fighting for nutrition and blood supply, it can mean that some of them are not getting the nutrient supply that they need. Because if some of them are in distress, it does happen sometimes that we'll have to get in there and get them out quicker, do a cesarean if we have to.
You do what's necessary.
Who have we got next? We're going to see puppies! I love puppies!
In Sydney, sisters Dr. Alison and Dr. Audrey Shen are heading to their next booking.
Can't wait.
The identical twins run a mobile vet clinic.
I don't know what it's like to not be a twin, but it's definitely
the best thing
advantageous.
We work together, we have the same likes, we know what the other one's feeling. Yeah, and we're the other half of each other.
Okay, we're
here. Today we've got a gorgeous litter of American Bulldog puppies, all 6 of them.
Hello!
How are you?
How are you?
My hands full a bit.
Oh, they're gorgeous. When you've had back-to-back consults, you go see a puppy and it really brightens up your day.
You just want to squish them and smell them and hug them.
Owner Aaron is also smitten with his lively 4-legged family.
I've always been a big Bulldog fan. They're very loyal dogs, strong, and they give good hugs at night.
So we're seeing them for their vaccinations today.
Vaccinations and worming.
Excellent.
This is the big Iggy.
We've got 6, so it's just going to be like a production line, carrying the puppies over the fence.
Getting our arm weights going there.
Let's have a look in there.
Today's vaccinations will help protect the puppies against a range of viruses and diseases that can be deadly to young dogs.
Little mosquito bite, and it's done.
Didn't even feel it. These regular checkups for puppies are really important. We time it with the vaccination. 8.25.
Good weight.
That way we can actually vaccinate them, have a look at their weight, their nutrition. Just listen to your heart.
And just picking up congenital issues as well, so issues that might develop in the next couple of weeks after they're born. That's why, at least 3 checks while they're puppies are very important.
This one is Fat Joe.
Aaron's got a very unusual choice of names.
It's a Fat Man Scoop.
All named after different song artists.
This is Left Eye.
Oh, you're heavy.
Bob Marley.
Hello, Bob Marley. Oh, you're the serious one. I can see it.
And the last one, Beyonce.
Hi, Beyonce. Aaron's quite a character. When you first meet him, he looks quite tough on the outside.
Covered in tattoos.
But then with Beyonce,
it's just the cutest thing. He's cuddling Beyonce, she's licking his face. I just pretty much
all
melted.
gooey and soft on the inside.
Beyonce has to have a manicure.
Obviously, seeing the mobile vet's a lot easier than me trying to cart puppies, carrying them over my shoulder, in my pocket, around my shoelaces to a vet.
Okay, last one back. All 6 puppies, totally healthy, well looked after.
Clean bill of health.
Aaron's doing a really good job.
I'll go get the mum and dad.
Go see Mum and Dad?
Mummy's coming, Dad's
Cricket,
coming.
Ziggy, come on.
Oh.
Hi.
Good boy, good
This is
girl.
Dad, and this one's Mum.
Yep, so Ziggy and Cricket.
Ziggy, you're huge. At the end of the consult, Aaron goes, I have 2 more puppies. And we're thinking, what? Where are they hiding?
More,
You're kidding me.
Yeah.
And then he lifts up his pants and
There
we're
they
sort of
are.
like, hold on a minute, what are you doing?
I've actually got
Ah.
Cricket.
Oh, that's a splitting image.
and then Ziggy.
Mum and Dad.
It's you.
Thanks for everything.
Lovely to meet you and your extended family.
Yes.
Getting to play with Mum, Dad, all the puppies.
One big happy family. I think he actually said with the Brady Bunch of the American Bulldogs.
Totally.
Thank you.
See you
All
later.
right.
Thank you very
See
much.
you guys. Bye.
Thank you.
So this is what I could feel in the intestine.
At the Bondi clinic, Kate has just x-rayed 3-year-old Dachshund Gary to find out the cause of his vomiting.
Looking at these x-rays, I can see straight away what Gary's problem is. The white mass on those x-rays, it can really only be one thing, through here. So now, we've taken some x-rays.
Yeah.
And this is what we've got. This is an intestine.
Yeah.
And this, all this white in here, this is all sand. A bucket of sand.
Oh my God.
I ate
Gary.
sand. And now we have a blockage. If you can imagine, you've got sand and it's kind of wet in there and it basically becomes like concrete. It means that nothing can actually go through and that's why we're seeing the vomiting.
If the sand ruptures his intestines, Gary's life will be in danger.
Oh my gosh.
Right? This is most likely a surgical problem.
Sorry, I didn't expect you to say all this. I'm a bit in shock.
Surgery is a big deal for a little dog. But if we wait, we risk that intestinal wall breaking down and rupturing. If that happens, we're in a completely different situation to what we're in right now. The second option is that we try and see if we can't get some of this sand to move. Realistically, Anna, if we can't get this to move in the next 24 hours, he could die from this.
I don't want him to have surgery. I'd rather see if we can flush it out somehow.
You're right in not underestimating the size of this surgery.
Yeah.
So let's give this 24 hours, but in 24 hours, if this has not shifted,
then we'll have to
we go in.
Okay. I did not expect to hear that he would have to go into surgery at all, and also just really worries me because then he'd have to recover from an operation. You be brave. Love you. Gary means everything to me and I wouldn't want to be without him. Thank you. See you soon. I'd be completely devastated. Fingers crossed.
Come on, little mate. Let's see if we can get this moving. There you go, darling.
Kate needs to help Gary pass the sand quickly, otherwise his prospects are not looking good.
You want this? Yes.
The most important thing is getting him hydrated.
There we go. This could be that in 24 hours we're dealing with a dog that's likely to die. So it's a 50-50 chance here. Come on. Only time is going to tell us.
All the puppies' heartbeats that I've seen so far look fine.
On the Gold Coast at the Animal Emergency Service, vets Alex and Gerardo are performing an ultrasound on heavily pregnant Greta to check the heartbeats of her 12 puppies.
What we have here is little puppy's heart, and the heart's beating nicely.
Marie, these tests help us to give us more information, but really, we're not going to know how things are going to go until it actually comes time for her to deliver.
Okay.
Now, we can't possibly see all of the puppies on ultrasound, but the ones we can see look healthy, and that's really good news. So everything so far is looking good.
Perfect. Thank you very much.
But the news is bittersweet for owner Marie.
Hi, Dane. This is where I have to totally rely on you, Alex, because I'm not going to be here, I don't think. I have to fly over to New Zealand. My mother's dying. So I fly out tomorrow morning. I'm staying there until she passes away, which is probably going to be within the next 48 hours. So I totally have to rely on you, Alex. And she'll be well looked after with my friend Judith, who's flying over from New Zealand to look after her for me.
You take care of your mum.
Yep.
Judith and I can look after Greta. Obviously, we're going to let you know how we're going every day. And when it's time for her to have the pups, we'll be there with her.
Yep. I feel like I'm letting Greta down, but I'm not, because I know that you're going to be there, so... Thank you. It breaks my heart to leave her, but it would break my heart more if I wasn't with my mum.
The most important thing now is for you to be with your mum.
Yep. My mum was diagnosed a few weeks ago with terminal cancer, and there is not much hope of her lasting until the weekend.
Marie, you know we're going to take really good care of her and look after her.
Thanks, mate. If Greta can just hold on till Tuesday, I'd be the happiest person in the world, but if she can't, she's in really good hands. I trust her with you.
We could really start to see Greta deliver these puppies at any moment. And so I'm going to be there for her in every way that I can.
You try and wait. Good girl.
Over at Perth Zoo, Dr. Peter Ritchie's day is already off to a busy start.
Our day-to-day work here mainly involves wildlife animals to keep healthy animals healthy. So who have we got here, Steve?
This is little Alia, one of the orphan quokkas that came to us from Rottnest Island a few years ago.
I love the zoo because it is a magical place. The work that is done here saves wildlife. Pretty excited to see Azuri.
After his morning rounds, Peter's next patient is one of the zoo's latest additions.
Azuri has come to us from another zoo. She's here to start our breeding program. These guys are vulnerable in the wild, and it's really important that she breeds to contribute to the preservation of this species. The main reason Azuri has come into the clinic today is because she has an implant in her that is suppressing her sex hormones and stopping her from being able to breed. So we're going to remove her implant. This will allow her to breed with males when we bring them to Perth Zoo.
Azuri has returned to her sleeping quarters, giving zoo vets the opportunity to anaesthetise her ahead of the operation.
The most dangerous part with her anaesthetic procedure is when she's been darted and we're transporting her.
Big cats are at risk of dying suddenly while under anaesthesia, so the team must work quickly.
It's definitely a very big deal moving a 180-kilogram cat. It requires 8 people to carry her. She is a bit of a dead weight when she's asleep and anaesthetised, so that's 180 kilos that we're having to manoeuvre from her exhibit into a van and into our veterinary hospital.
3, 2, 1, lift.
It's an intense moment when we've got all those people in close proximity to a potentially lethal animal.
Just watch your noggin.
"24 hours have passed and Kate is hopeful there's been progress getting the sand in Gary's stomach moving in the right direction.
We've just taken another x-ray on Gary. Yesterday we saw the sand all gathered up around this area. Today what we can see is it's started to move. It's travelled all the way down. So what we can do here is we might even be able to give Gary an enema this afternoon and see if we can't get this to come out the back end, which he's not going to love, poor old Gary, but it's a lot better than having surgery. Let's cross our fingers that that's going to work.
In the examination room, Nurse Francesca readies Gary for his enema.
Time to sort you out.
Come on, little mate.
Come on, darling.
It's going to be super uncomfortable.
Oh, it's got to be done.
Just got to get that little bit out, Chook.
Oh, be over soon. Oh, I know, sweetheart. Oh, dear.
Kate is hoping the injection of fluid will help stimulate Gary's bowel.
There we go. Well done.
Well, there's definitely poo coming down the chute.
Yes.
Now the sand is in the colon. 10 minutes is all we need, and hopefully everything will come out that back end. We just need one really big poo with sand in it.
Can you do that?
Grit and sand. And then we need you to not ever eat sand again.
Yeah.
Because it's been very stressful. Reckon we can do this, kid? You got this.
Pressure's on, mate.
Come on. One big poo.
Come on.
You got this.
Oh, he's sniffing.
Oh.
I feel like he's sniffing. Oh.
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 Oh, he's definitely got
he's doing a wee. Number 1. We just need that number 2.
The pressure's on for little Gary. If he can't get the sand out, he may be forced to undergo emergency surgery. With Azuri the Lioness now unconscious, she's transported to the Perth Zoo clinic, where Peter and senior vet Simone are ready to take over.
Bit nervous at the moment. We want to get things happening very quickly. Big cats hold risk under anaesthesia, and the longer she's under, the bigger the risks.
That's it. Just watch your head, guys.
Ready? Okay. Okay, poles on the end of the van.
It's going to be our only chance to get our hands on her and get up close and personal.
Right, shall we start having a look at a few things,
Sure.
Pete?
Do you want to get catheter in? Or...
I'm going to clip that right now.
The team needs to remove Azuri's contraceptive implants without delay. With every minute critical, everyone is under pressure.
Now we've got her on the table, we're going to start our procedures. We've got to work quickly. It is dangerous for her to be under anaesthetic for too long.
Can we just move back a touch, guys? Yeah.
Azuri must be intubated to monitor and control her breathing during surgery.
Down a bit though, guys, because I'm 4 foot. Oh, God.
I thought you wanted to use the smaller one.
That's in.
I'm happy that's in.
The team must now perform an examination and vital tests before they can begin surgery.
How much do you need?
Only 3 mils, but I'm going to get 5. It's a known risk that potassium levels will rise and spike in big cats when they're under anaesthetic. This is a really bad thing if it happens, because it will mean that Azuri will suffer from a cardiac arrest.
What do you reckon, Pete? Have a look.
Doing a dental exam on a big cat is one of my favourite things. Their teeth are just incredible. Just see the damage that they could do to you, to an animal, that they're prey, and there's just so much power in those muscles in that jaw.
Beautiful young feet, and feel how tough those pads are.
And she is very young looking, isn't she?
Oh, I know.
We'll have a check over her whole body, looking for any lumps and bumps. A general physical exam is vital at this point to ensure she doesn't have any health issues. I'm looking at her ears. It's all looking really good at the moment. There's nothing I need to clean out, so we'll leave that at that.
The last blood sample is taken and Azuri's physical examination is complete.
Shall I be your nursey?
Just doing a surgical scrub before we surgically remove the implants in Azuri's legs. want to be sterile with this procedure so we don't introduce any infection.
If the contraceptive implants can be safely removed, Azuri will be able to join the breeding program at the zoo.
Implant there underneath her skin, so literally see it and feel it there. And we'll just be making an incision around that and removing that completely.
We're about to start surgery.
I'm cutting, yep, first incision.
Pressure's on, mate.
Pooing, pooing, pooing.
Back in Bondi, Kate and vet nurse Fran are waiting for little Gary to pass sand.
Come on, mate.
I just can't poo under this pressure.
Come on. Oh.
The Dachshund swallowed it when he ate ice cream from the beach. If Gary can't get the sand out of his system, he may have to undergo urgent surgery.
Just one sandy poop is all we need, Gaz.
What I'm really hoping will happen is that Gary does a really big poo and it's full of sand. Because that means that we're well on our way to getting Gary home.
Come on, mate.
Come on. No.
Oh, I saw some crouching. Oh, I think we are winning.
We've got a poo.
Oh! Yes! Let's do a poo dance.
I can't even count the amount of times as a vet that I stood next to an animal and cheered when they've had a bowel movement.
Yeah, it's gritty.
Yes.
Amazing. We've got sand and we've got poo. Very happy. Success.
Yay.
Nailed it, Franny.
Yay to pooing.
Come on. Don't leave anything off the ground. Got it?
Ravenous Gary is fed a meal to make sure he can keep his food down and be given the all clear to go home.
Hold your horses. Wow, you look like a different dog today, don't you?
And it's not long before his owner Anna arrives to collect him.
I'm so excited that he gets to come home today and can come back home and he's all better and everything's sorted.
Can you hear your mum outside? Can you hear? Yeah, you naughty little monkey. Oh my gosh, it's so excited. It's so excited. Ah, Groover. Come on, let's go. My goodness.
Oh, there he is. Cruisy, there you go.
Hi. How are you? Are you better? There he is. There he is. Oh, how much better do you feel? Hi.
The reward at the end of all of this hard work is that you get to send an animal home.
Hi. Yeah, hi.
Look how much better he is.
Gary has gotten out of this by the skin of his teeth. It could have gone either way, so it's been a really good outcome.
Aren't you, Pupples?
I do think he is like a magical dog and a lot of people have said that to me. I'm proud of him and he's the best dog in the whole world. I couldn't be happier with the result.
Okay, you, no sand eating. Anna, look after him.
I will. Thank you so much for everything.
No worries.
Thank you.
See ya, you guys.
At the Perth Zoo, Peter and the team are working to remove contraceptive implants from 3-year-old Lioness, Azuri. They hope she can enter the zoo's breeding program to help preserve this vulnerable species.
It's incredibly tough. It's much, much tougher than a domestic cat. These guys are obviously designed to withstand other lions and hyenas biting and scratching and those sorts of things. So their skin is very different when we're suturing it, placing catheters, giving injections, and you have to have a bit more elbow grease, I think, in there.
It's Peter's job to locate and remove the implants that have been preventing Azuri from conceiving.
The implant is rather tiny. It's only a couple centimetres long. There are 2 of them and they kind of look like a little bit of candy.
Just hold on to it. Yeah, that's it. There are 2.
I think there's one on top of the other one.
Oh, okay. Lovely. And I'm going to steal a swab and get you to give that to me, and then I'll have a look at how much we've got there. All right.
The implant's out completely, which is good. I've just got to do my skin sutures now, and that'll be it. We're going to have to wake Azuri up quickly. For her own safety, we want to get a move on and get her back into her enclosure and get her awake from anaesthetic. We've done everything that we're going to be able to do with her now.
Until the Lioness has been successfully woken, everyone is still on edge. On the Gold Coast, the moment is finally here. After a long wait, Greta is in labour.
Good girl. You're doing so well, Greta.
And she's already delivered 5 of her 12 puppies.
She just got into it and knew what to do, and off she went.
Sadly, Ona Marie is in New Zealand to be with her terminally ill mother. So daughter Melanie and friend Judith have been on puppy watch.
A little stressful, but me and Judith have been a good team, so it's been good.
But with so many puppies expected through the night, they've called in vets Alex and Gerardo for much needed help.
When I got the phone call, I turned to G and said, I promised Marie that I would be there, so let's go.
Hello?
Hello!
Oh, goodness, it's all happening. Hello!
Sure
wow,
is.
how many have we got so far?
3 boys and 2 girls.
Wonderful. Marie is going to be so excited.
Are you cleaning your puppies already, Greta? Oh, she's just been amazing.
She's just acing this. The licking that she does will encourage them to take breaths.
Although Greta's doing an incredible job helping her puppies to breathe,
And we've got some pushing there.
she's feeling the strain of delivering such a big litter. And puppy number 5 is struggling.
This one's a bit blue, hey?
Yeah, he's a bit quiet, that one.
You want me to rub him a little bit?
She's a first-time mum. She's got a lot of puppies. There's a lot of things that could go wrong.
Yeah, when they're born, their lungs are filled with fluid, so they have to quickly get rid of that fluid to try to then get air in their lungs. That's probably the reason why Mr. Blue looks a little bit blue.
A little bit blue,
He
actually.
looks a little bit blue.
Gerardo's vigorous rubbing works.
That's better.
Yeah, and I think there's another one on the way. Here we go, we got a puppy.
Puppy, good towel?
Come on, push little darling. With good girl Greta. Puppy number 6 arrives and it's a little boy. So this little pup's still got the placenta attached, but we're just gonna let Greta have a good lick there. That's it.
Suddenly, there's another surprise arrival. Ona Marie calling from New Zealand.
Hey Marie! We got 6 bundles of joy for you, Nana.
You're doing a wonderful job.
Greta gets all the credit. She's doing all the hard work here. And I think there's another one on the way very shortly. Oh, yep, here we go. We got another one. Here we go. Yay!
Wow.
Marie has just been to her mother's funeral today. This would have to be one of the saddest days of Marie's life. But seeing these puppies being delivered, I think it's quite healing. Gosh, that one caught me completely by surprise.
An emotional Marie is overjoyed to witness the arrival of 3 more puppies.
She doesn't seem to be having any problem at all.
She's been great.
But no one can relax just yet as a 10th puppy arrives.
I was going to give that to you up there. Okay.
This tiny puppy is in trouble.
Very lively.
Come on, sweetheart.
I delivered the 10th pup and I just know there's something wrong.
Come on, breathe.
Come on, little one. Hey.
Breathe.
I just hope there's something we can do to bring this pup through.
Come on, sweetheart. Come on. Greta, we are trying, honey. Come on. Come on, beautiful girl.
So I'll take her off the machine and then we can come out.
At the Perth Zoo, Lioness Azuri is returning to her pen after surgery to remove birth control implants.
It's been an incredible day. It's an amazing experience to get up and close and personal with a critter like Azuri. And we'll await some results from our tests, but all in all, Azuri's passed with flying colours with her medical exam, and I've definitely had a pretty exciting day at work. They're going to pull the stretcher backwards, yeah.
That's lovely. That's
There
a
we
great
go. Yeah. She's now waking up and we're giving her drugs to reverse some of her anaesthetic medications that are going to make her become conscious very quickly. So this is a very risky time.
Oh, Zuri, there's an eye. Hello. Oh, there we go. That's a real blink.
So she's just started to recover. She's staring, she's moving her head, her eyes have come back to normal, and she's looking good, and most dangerous bit's over now. Azuri previously had an implant in to prevent her from breeding too young of an age. Now that it's been removed, she's going to be paired with an appropriate male and hopefully has some little lion cubs.
Breathe.
On the Gold Coast, Alex and partner Gerardo are helping to deliver Greta's pups. 9 have arrived safely, but the 10th is in serious trouble.
Come on.
The puppy's heartbeat is faint and it's not breathing.
I really want to be able to save this little girl. I'm also aware that Marie's she's watching all of this, and I can only wonder what she must be going through at the moment.
Is it not responding?
No, we do this for a while.
G and Judith are working on this little pup, but I know from G's face that he's really not getting any response.
There's no movement at all.
We've lost the fight for this little girl.
I'm sorry.
We've lost one, Mary. I'm sorry.
We're all devastated, but we've got to get back to Greta because she's still got more puppies to deliver.
Good girl.
And she's going to need all the support she can get.
Oh, that was a big push, that one.
She's looking really tired, eh?
I think she's given it everything to this point.
Greta, you're a good girl, darling.
This one's coming backwards.
It's puppy number 11.
Oh, that's the whole thing.
No, there's not much movement. Come on, come on. All right, Gerard, I'm going to hand this one to you.
Ready? 1, 2.
Yep, you got to.
Yeah. Oh, come on.
Come on, hey.
We got a light one.
Yay.
Hey.
Yeah, listen to that, Judith. Can you hear that, Marie?
Yeah, I can.
There's a lot of strength in this one. I'm sorry.
What a great noise that is, hey? That's a relief to hear that.
Nice pink little nose. Means she's taking lots of oxygen into her nice dry lungs, eh?
I think there's one more on the way, I. We just needed to get this last one out. There we go. Come on. Yeah, he's moving. He's moving, Marie. Lucky last. Pretty big for the last one. Aren't you? 6. It's a boy. Hey, that's your last baby.
Good girl, Greta.
The last puppies arrived.
How's that little one going? Hey?
Yes. And they look great. They're in good health. Greta, she looks tired. We're all pretty tired, actually.
Very proud of Greta. She's a good mummy.
You've done an awesome job, Alex and Gerardo. And Judith and Mouse. Thank you so much.
I think we've all done a fantastic job, but the credit has to go to Greta.
11 of Greta's puppies have made it, but they'll have to be closely monitored over the next few critical days to make sure they're healthy.
You just come home safely, Nana, and your extended family will be waiting for you when you get here.
It's a big family.
It sure is. You're going to be one busy Nana.
Good boy, Gary. Good boy.
1 week later, after narrowly avoiding surgery to remove sand from his stomach, little Gary is back on his feet and able to enjoy a walk at the beach.
Good boy.
His owner, Anna, has brought him back to Bondi to see Kate once again.
Oh my goodness, fancy seeing you guys here. You're looking good.
Yeah, he's really good. He's totally back to normal now.
Going forward, I'll always be on the lookout for anything he's eating now, to be honest, even though he gets his way most of the time still.
I've got something for you. Wait, ready? Oh, chicken treats! I gave Gary a little treat. I felt bad, he'd spent a lot of time at the clinic, so I thought, you know what, the least I can do is give him a little bit of chicken. See ya.
Thank you so much for everything, and thank you for saving his life.
It was so good to see Gary. He was one sick dog. He's back to his normal, energetic, adventurous little self, and I love to see him like this.
Yay! Is your babies?
Yes.
And on the Gold Coast, Marie is now back from New Zealand and has her hands full helping Greta with her thriving family.
Good babies.
And they're about to get some very excited visitors.
I'm really looking forward to seeing those puppies, eh?
Hello!
Alex and Gerardo are keen to see how the newly expanded family is doing.
Oh my goodness. Is that not the cutest thing? Gosh, she's so attentive, isn't she?
She's doing a really good job.
Greta looks fantastic. She's obviously loving her new mum life. She's looking after them. She's in there making sure they're okay. She just looks like she's born to do this.
It's more like puppies. One of the things we wanted to do today was actually do a little health check on the pups, but once you see them walking around in their little crate, crawling around, making puppy sounds and suckling healthily, there's nothing we needed to do. They just looked amazing.
Now your eyes are open, there's no stopping you guys, I'm sure. I've seen lots of puppies born before, but these guys, this is really special because Marie's part of our family at the hospital and because I was part of bringing them into the world and seeing them now, it's a special moment.
Hey guys, how you going? My name is Pete. And how's Medley going?
She's had an anal prolapse.
You need to replace that because that bit of tissue that's sticking out is going to become dry and necrotic and fall off if we don't put it back in there.
Medley is suffering from a prolapsed cloaca, the opening to the reptile's reproductive organs and anus. It's a serious issue, so Peter quickly takes the python to the treatment room.
All right. Hey, sweet bee. I'm scared. I know. Bit terrifying, isn't it? You can see that nasty looking prolapse that's hanging out from her cloaca. So it's more than likely occurred when she's passed a fecal or defecated. A prolapsed cloaca is when the tissue that's meant to be on the inside of the snake's rectum or uterus has exited through its cloaca, so the hole that they have at the back of their body, and it's come outside of the body. It's a risky thing for them to have because that tissue that's now come out of their body is usually constricted, so the blood supply is compromised and is at risk of dying.
Southwestern carpet python numbers are on the decline in Australia, likely due to habitat loss. But keeping them as pets can bring health problems.
Medley, she's probably a little bit overweight, and that doesn't actually help with this condition. She is a non-venomous snake, may still bite. A, because she's at the vet clinic, B, she's in pain as well. So there is a potential that she'll bite me, but if she does, it won't kill me.
For the procedure, Peter has called in colleague Dr. Claire Sharp to assist him.
A snake definitely feels pain. How they perceive that pain is probably somewhat different to other animals, but they definitely are very capable of feeling pain. And this is a very painful condition, and we need to replace this rather quickly so that pain goes away. So I'm just giving it a little clean with some saline first, just to get any of the sand off that's on there. We can see it's kind of everted, a little bit like unravelling a sock, and the end of it is just sticking out there. So I need to kind of gently work it back in. If that's not successful, we need to go to a surgical option. So we'll need to give her an anaesthetic to replace that, and I'm hoping to avoid that tonight. The tricky thing is it does want to come back out again. I've just noticed why she's prolapsed.
Oh, goodness.
Yeah, you see it too?
Yep.
Good boy. Good boy. You're going to come out, we're going to fix you up.
On the Gold Coast, Alex and vet nurse Tracy are ready to treat Jimmy Choo. The Staffy Labrador cross has extensive bite wounds after a run-in with the dog next door.
He's just had a big heavyweight fight. Get you all cleaned up. Bernadine, his owner, has told us that Jimmy actually started the fight. He lives next door to a big dog called Bruce, and they've never got along. But tonight, Jimmy's dug his way under the fence, got into Bruce, and the fight's been on. And now we need to pick up the pieces for Jimmy because he's in a bad way and he's going to need a lot of help tonight. Are you going to go have a little sleep, Jimmy? You ready? There you go. You can go to sleep.
With Jimmy sedated, Alex can now get a better look at the injuries.
You can tell from the puncture wounds just how big these teeth are that went into Jimmy. And what we don't know is what kind of damage is underneath the surface. So tonight, we're actually going to need to explore all of these wounds to find out exactly how much trouble he's really in. Hang in there, Jimmy.
I've just noticed why she's prolapse.
Oh, goodness.
Yeah, you see it too?
Yep.
At the Perth Animal Hospital, Peter has just discovered the cause of Medley's prolapsed cloaca, and it's not from passing faeces.
So I've just realised she has an egg that's trying to pass. It doesn't look like a completely normal egg, but you can see right there's an egg that's coming out. So her uterus and her anus come out the same hole, so the cloaca is the only hole that these guys have at their back end, and part of the reason she's tried to prolapse today is that she's got eggs that she's wanting to pass. The egg is not calcified at the moment. It's an immature egg, so she's still forming these eggs. They're not quite ready to be laid. So they're not firm and hard, they're soft and gooey at this point, so there's very little risk of me breaking that egg.
Fortunately, Peter manages to safely ease the protruding cloaca back inside Medley's body, just as she's starting to get restless.
All right, back in. Good girl. I'm gonna give that little massage down. Once that tissue is replaced, the vessels now can relax and the blood supply can return normally, which is the most important thing. She's at risk of this happening again, especially because she still has to lay those eggs. And when she goes through that motion of laying an egg or passing a fecal, contracting her abdominal muscles, she's more than likely going to reprolapse.
Peter may have to conduct surgery on Medley in the future, but until she's passed her eggs, she'll be sent home to be monitored closely by her owners.
Just putting it back in is the fix right now. At least we have an answer as to why she's done it tonight. It looks all okay now, which is good. All right, sweetheart.
It's definitely good to see that it was something like being gravid rather than something like a bacterial infection. So at least at this point, it looks like she'll be able to recover properly.
Hang in there, Jimmy.
So we've got this one here.
Yep.
There's nothing on this side?
Yeah, there is. There's more down here.
At the Gold Coast Animal Emergency Service, Alex and vet nurse Tracy are discovering just how badly Jimmy Chew has been mauled during a fight with another dog.
He's been chewed from one end to the other. This one here, that's actually the one that I'm most worried about because it's right over the top of his kidney. The other dog that he was in the fight with is a much bigger dog. So if the other dog bit down really hard with those long canine teeth, it may have penetrated into one of those vital organs. So I think we want to obviously clip up all of the wounds, but this might be the one we go looking at first.
Yep.
Look how big that tooth must have been to go all the way down. Oh, look at the bruising. Gosh, he is just black and blue under here. This is just so nasty. We're going to have to clip most of Jimmy's hair off. It's really important that we find all of those wounds. I'm just horrified to think that another dog could do this kind of damage and to think that Jimmy started it.
As they reveal the numerous bites sustained by Jimmy, Alex discovers a very deep and concerning puncture wound.
Wow, look at that. It is starting to look nasty. It looks like it has gone into the abdomen. That makes this much more serious. We would be talking about abdominal surgery. We might even have to remove the kidney if this is as serious as I think it might be.
Hey guys, how you going? Who have we got here?
Hello. Back at Perth's Animal Hospital, no sooner has Peter gotten one patient safely out the door than he has another emergency to deal with.
Up here.
3-year-old American Bulldog Cash has been brought in by his worried owners, Tracy and Neil.
Nice. Come on, freak.
While we were out, we came home, found an empty bag of macadamia nuts on the back lawn. So he's obviously got them off the bench and ripped open the bag and eaten them all.
Good boy. Can I have a little listen?
But owners Tracy and Neil know it's no laughing matter, as eating macadamia nuts can be fatal to dogs.
I'm concerned about the macadamia nuts. How many roughly do you think he's eating?
130 grams was the packet.
Okay, and just the nuts, they're not chocolate coated?
Not chocolate, they're just raw unsalted nuts.
Yeah.
We ate the entire packet.
This is quite concerning because macadamia nuts are toxic to dogs, and the worst thing that can happen with dogs was that they start to show neurological signs. He could potentially start to tremor this evening and become very weak and ataxic, and a lot of dogs will tend to overheat with the tremors as well, and if that happens and their body becomes too warm, they can go into multi-organ system failure. How long ago did he eat it?
Last couple of hours.
Last couple of hours, yeah, beautiful. So that means that hopefully the majority of them will still be in his tummy.
Yeah.
So hopefully we'll bring most of them up and we get most of those toxins out.
Right.
But there is a chance that some of them have moved out of the stomach into the intestines.
It's distressing news for Tracy and Neil, who've fallen in love with Cash since adopting him.
He's a rescue dog from an animal refuge here in Perth, and we didn't know much about him, but he had experienced pretty severe trauma as a young dog, and so he is very nervous, but you know, we love him, so it doesn't really matter.
Cash is our family. Cash is, it's Neil and me and Cash, and that's who our family are. He's, you know, my mum and dad are his nan and pop, and he's part of the family, so he's probably the most important part.
Time is important, so we'll bring him through so we can try and get all those things out of his belly as soon as possible. Ready? Yeah. Come on. No worries, yeah, come through. Go. Come on, mate. Oh yeah, if I take you, do you let me? Come on. It is vital that we treat Cash straight away. It's important we get those macadamia nuts out of his gastrointestinal system so he's not absorbing the toxins. It is a serious and life-threatening condition.
Hey, Jimmy. Good boy. You seen this?
Yeah, I think that's our biggest concern. Tooth going into an organ.
On the Gold Coast, vets Alex and Gerardo have discovered alarmingly deep dog bites on Jimmy Chew and need to urgently perform an ultrasound.
So what we can see, he's got pretty good blood supply to his kidneys. So the structure looks okay.
No free fluid.
No, there's no bleeding or fluid around it. Let's have a little look at his liver.
Yeah, because that liver's right next to it, isn't it? So
Yeah. And the liver looks okay as well from what we can see here. There's no bleeding that we can see either.
that's a good sign.
That's a good sign.
Yeah. The ultrasound showed us that the kidney, liver, the organs were all looking really good. We couldn't see any evidence of injury, and that gave us a lot of confidence that maybe Jimmy had got away with it better than we thought.
But now, Alex and vet Dr. Brooke Shampers have to begin the painstaking task of opening up and cleaning each of Jimmy's numerous bite wounds.
Look how big that is.
That's so significant.
That's a huge pocket, isn't it?
So much dead space.
I think where he's bitten him
and then shaken and pulled all that skin off, the
pulled it off.
muscle.
There's a huge dead space under there. So I think what we're going to need to do is actually get in there, clean all that out, and then we'll work our way around all of the bite wounds. All right, let's do it. Poor Jimmy, he's come in here with these bite wounds all over him, and we're actually going to make these wounds even bigger. We have to open them right up to get inside and clean everything out, because there'll be hair, there'll be dirt, there'll be dead tissue down there. If we leave any of those wounds untreated, it could set up a nasty infection and he could be in hospital for a lot longer.
All right, time for your injection.
At the animal hospital in Perth, Peter is administering apomorphine to Cash to induce vomiting.
All right, ready? Time for a little bum jab.
The American Bulldog ate an entire bag of macadamia nuts, which are extremely toxic to dogs.
We'll give him a few moments.
All right, sweetie, I'll grab that.
I've given Cash his injection of apomorphine, and I'm hoping that he's going to vomit very soon. What we should see is that he starts to lick his lips and hypersalivate, so drool a little bit as well. After that, we'll notice his heart rate will go up, he'll start to pant, and then we'll start to get those abdominal contractions, and then all that will lead to, hopefully, a nice big vomit.
Starting to feel a little bit nauseous now, I think.
Yeah.
And the lip smacking.
If Cash can't bring up the nuts, the toxin could seep into his system, causing him to overheat and convulse. In the worst case, his body could begin to shut down.
It's all right, let it out, buddy.
At the Bondi clinic, Nurse Fran rushes in an injured wild possum to see Dr. Kate Adams.
He was found huddled in a corner. There was loads of dogs barking.
Do they know what happened to him?
No, but they just obviously saw that he was in distress.
Poor little guy. We see quite a lot of possums around the Bondi area. We either see brush-tailed possums or ring-tailed possums.
What kind is he?
He's a little ring-tailed possum.
Oh.
So you can tell a ring-tailed possum because they always have the little characteristic little ring tail, but he's in a bad way.
Yeah.
Oh, sweetheart. Oh. Come on, darling.
Oh my God, his eye.
No, he's got a really bad eye there. He's lost quite a lot of fur, so he's had a fight with something.
Oh yeah, you can really see his eye actually.
Little thing.
Go on.
There you go, mate. Ring-tailed possums primarily live up in the trees. They always make a nest in a tree, and that actually makes them a bit more susceptible to injury, particularly from cats. Hey, little guy.
He's not reacting at all.
No, he's not, is he? Let's not do an examination just yet.
Okay.
Let's hold on that and let's get him some antibiotics. We need to get him some pain relief. Let's let him calm down and put him in a little dark cubby.
Yeah.
Right? The least stress that we can cause him right now, the better. Wildlife get really stressed and they're wild animals. They're not used to being handled. So stress reduction is our main priority here. We're just going to give him some antibiotics and some pain relief. Because pain relief is very important right now for him. I know, little guy. There we go.
That'll feel better.
Right, let's make up a bed for him.
Cool. Right, come on then, little man.
So for the next while, it's a little bit of a waiting game. We need to put him away in a dark, closed area where he can just de-stress. I don't know that he's going to live. I don't know if he's got much shot, but we're going to try and give it a go.
You've got to pull through this, mate. There we go.
In Perth, Cash has just been given a drug to induce vomiting.
I reckon this is the worst feeling in the world.
The American Bulldog has eaten a large amount of macadamia nuts, and he needs to bring them up before he becomes seriously ill.
Come on, buddy. It's important we get those macadamia nuts out of his gastrointestinal system so he's not absorbing the toxins. So if we don't do anything about this, he is at risk of overheating and causing organ damage to multiple organs. It is a serious and life-threatening condition. He's starting to get the contractions happening in his belly now, which means the vomit's going to be pending any moment. Here we go. Come on, buddy. Whoa. Yeah, there's a lot of nuts in that. Oh, wow. Oh.
You feeling a bit sad after that vomit, mate? This is why you don't eat macadamia nuts.
So Cash has just vomited up a very large amount of macadamia nuts in there that definitely would have caused toxicity in him.
All right.
Peter now gives Cash an injection to stop him vomiting.
Good boy, be brave.
The reason we're giving him this is so that I can give him some activated charcoal and a laxative, which is designed to bind any of the toxins remaining in his gut, and he'll pass them out the other end.
Here we go.
While Peter prepares the treatment, Cash is reunited with his owners, Tracy and Neil.
You're relieved.
Relieved that it was all. It all came out and he already seems much happier. Feeling better?
Hey, mate, you hungry? Come on, a bit tired now after that, aren't you? This is mixed with a bit of chicken, so basically charcoal chicken for him. The idea being if he has any more toxins left in his belly, this will bind it and remove it from his system as quickly as possible. All right, buddy, do you want to wake up and have some food? What's this? Ooh, does that smell good? It looks disgusting, but it is the best thing for him right now. Let's hope he eats it. Come on. Maybe if you try and offer it to him, it might actually work a bit better. Strange man trying to do it. Oh, good man. Oh, you must love him very much. Tastes good. There we go. That's what we want.
Cash can now go home with Tracy and Neil for lots of TLC. But there's one thing not on the dinner menu tonight.
No more macadamia nuts, that's for sure.
None of those.
Hello, mate. You feeling better? You look a bit brighter than the last time I saw you. Hey?
On the Gold Coast, Jimmy Chu is slowly recovering after a lengthy operation to treat his extensive wounds following a vicious dog fight.
We finished the surgery and Jimmy has more than 100 stitches, but this could have been so much worse. If this had been abdominal surgery, he would have been in here for up to a week. At least now he's on the road to recovery.
Are we going to go for a bit of a wander? What do you think? Come on, you can do it. Good boy. I think your mum's going to be very happy when she sees you. Good boy, Jimmy. This way, this way, this way.
To help Jimmy's recovery, Alex arranges a surprise for him.
Hey, Jim. Oh, good boy, good boy, good boy. I've got something special here for you.
In Sydney, mobile vets Doctors Alison and Audrey Shen are making a house call to examine a little dog with a big issue.
Hello. Hi, Audrey. Hi, Alison.
Owner Emma and her family are worried about a large lump on the forehead of their 18-month-old Boston Terrier pug cross, Tilly.
Hey, Tilly. How are you going? How are you going? Hi, cutie.
We're here to see Emma and her dog Tilly today. We've seen her previously about 2 weeks ago for a lump, and Emma's quite concerned because the lump has grown quite considerably.
It does raise alarm bells. We worry that it could be cancerous.
So we're going to check that out, see how much it's grown and whether we need to remove it or not. So how's she been going since our last visit?
Well, all good other than the lump continuing to grow, and we're getting really worried about it because we can almost see it growing daily and getting bigger.
Yeah, that is concerning. It's almost doubled in size, hasn't it?
Yeah.
Let's have a look at that lump. I know, sweetheart.
Oh, it's okay, Tilly.
But it's not bothering her at all?
She doesn't seem to scratch it.
Good, yeah.
The other day when she bumped into a wall or something, we noticed it was bleeding a little bit.
Oh,
Not a lot, but just like it was just red on top.
Yeah.
We first noticed that lump about 3 weeks ago. It was very small, black dot. I think it's tripled in size.
Yeah, it has grown quite a bit, hasn't it?
Tilly's had such a beautiful impact on our house, and the kids just love her. She's such a loving personality, and so I'm worried about poor little Tilly.
So because that lump's starting to grow, and we did voice that concern at the previous consult, it's probably best we go and remove it.
Yeah.
We can actually take quite good margins and send that off to the lab to find out exactly what type of lump it is, whether it's nasty or whether it's benign. And obviously we want to remove it sooner rather than later because we haven't got much skin to play with there on the forehead.
The bigger it is, the harder it will be to remove. And we've got to make sure that we remove enough margins to get rid of any possible cancerous cells. So we'd rather remove it while it's smaller than when it grows to quite a large size.
Hi, Tilly. You ready? Okay, you're coming with us. You say bye. Bye-bye, little lumphead.
It is always hard when we pick up the dog and take it away for surgery. You can see the concern on the owner's face.
If the lump is not removed and it is malignant, it could spread and be life-threatening.
All right, see you. Bye. Don't worry, she's in good hands.
I'm quite worried about the lump. Your mind jumps to what that could mean in the worst case scenario. I've really played it down for the kids because we'd all be absolutely devastated if it was anything serious.
There you go, mate.
Right.
At the Bondi clinic, Dr. Kate and Nurse Fran attending to an injured possum that was attacked. They've given him time to de-stress and have named him Pedro.
You're okay. You're okay. Now that we've given Pedro a little bit of time to rest, we're going to actually put him under a general anaesthetic and give him a really good once-over examination. Yeah, we're good. You can see here that he's lost all his fur from his back. Right, this is obviously because he's had an altercation with a cat or a dog. Doesn't seem to have any actual open wounds on him. What about around his neck here? I can't see any injuries around here. That's good. Can't see any blood coming from in there.
Can you see his eye?
I'm going to open this eye and have a look. Ooh.
Oh.
Poor eye.
Is it bloodshot?
Yeah. Checking Pedro over, we can see there is a lot of blood in that eye. Just hold that open for me. It's most likely that there's been a bleed when there has been the trauma and there's the residual blood in the eye. Bleeding into the eye is never a good sign. If that eye is not viable and he can't see and we can't get the eye better, he's not going to be able to find food. He's not going to be able to protect himself from any predators. In the wild, these guys, they can't survive with just one eye.
But Kate is hopeful Pedro's eye can be saved.
We're going to start to put some antibiotics into this eye. We're going to give it a crack. Cute little guy though, huh?
He's so cute.
He's so cute. You got this, Pedro.
Come on, Pedro.
Come on, Pedro.
Sort your eye out.
There you go, mate. All right, Franny, let's wake him up. Whoop, whoop.
He's awake.
Yeah, we have it. Okay, let's get him back.
Yeah.
Come on, little mate. Let's try and save that eye, huh? Let's do what we can.
Oh, he's looking at
dear. I look like a mess.
Oh, no.
Isn't he cute? Come on, Pedro. Put him back to bed. The next step is we're going to try and get Pedro eating. There you go, mate. It could have been days that he could have been sitting on that ground, injured. So it's really important that we get some food into him fairly quickly. There we go. But he feels like he's a little bit more at home in his little eucalyptus cave. There you go, mate. Left him some carrots and some banana. I think he might like that. He's had everything that we can possibly do for him. So let's just give him a little bit of time now and let's revisit. I'm crossing my fingers that when I look in here next, he's going to have gobbled up all of that food. All right, mate. Good luck.
In Sydney, Alison and Audrey are bringing 2-year-old Tilly in for surgery.
Today we're at the vet hospital with Tilly, and Tilly's come in to get the lump on her head removed.
Who do we have here? This is Tilly. Hi, Tilly. Are you okay?
Vet nurse Bree will be assisting with the surgery.
You be brave.
Okay, I'll prep her for her catheter, see how she goes with that.
Good girl. Your mom's gonna be so proud of you, honey. Right.
So because she's what we call brachycephalic, she's got a small little nose, we're just going to give her some oxygen before inducing her to keep her oxygen levels up. There's always a risk with any general anaesthetic. The dog is asleep on the table and we just have to make sure we're monitoring her very carefully. Her breathing, her heart rate She's not going to be under for too long, but
pretty quick.
it's still important
Yeah.
that we monitor her vitals.
Oh, buddy, you've managed to eat some of your fruit. This is good news. Can you come out of there? Let's get you out.
In Bondi, it's the day after Pedro, the ringtail possum, was brought into the clinic after being found injured from a suspected animal attack.
Hey, it's okay. That eye's open. It's looking a bit better now, isn't it?
Kate's antibiotic treatment has shown a dramatic improvement in Pedro.
Getting better, mate. Getting better by the day. It is so exciting this morning to walk in there and see that Pedro has actually eaten his food. It's a really positive sign that he's actually up and about. He has been obviously very busy overnight, and that's pretty normal for possums. These guys are nocturnal, so that means that their daytime is actually our nighttime. Come on, we just got to get some of your drops in. Must make it feel better. There you go. There you go. We're getting there, day by day. Just got to be patient with you, mate. We'll get you there. Pedro sustained a really bad eye injury, but it'd take a little while to recover. So given the chance, it looks like his eye is on the mend. Would you like a little bit of banana? Yum, banana. You want some banana? Oh, you like the banana. It's delicious, isn't it? Isn't he cute? Look at him. What we're aiming for in Pedro is to get him back and out where he belongs in the wild. Loving it, mate, loving it. But saying that, we're a vet hospital. It's not the ideal place for Pedro to rehabilitate. He needs to go to a carer who's going to be able to look after him while he's recovering. Let's get you out of here.
All right, we're cutting. We're going to go in the angle of her triangle.
Audrey and Alison have begun surgery to remove a worrisome lump on Boston Terrier Pug Cross Tilly's forehead.
So you're doing an elliptical incision around the lump. Has good margins there, so we can send that whole thing off for histopathology. Until that lump's out, we don't know what we're dealing with. The reality is it could be something nasty like a cancer.
We're always a little bit worried about lumps on the face just because there's not a lot of skin to play with. Tilly's lump growing could potentially get even bigger in the next couple of weeks. We need to really go in there and remove it, otherwise we don't have enough skin to close up.
Okay, here it comes. All right, we're
Coming out.
There's the buggy lump. Off to the lab you go. Let's find out what you are, hey? Okay, we're at the very last stitch now, closing up. It's gone really well. I'm happy with that. Okay, you're all done. Wake up time, baby girl.
So we're hoping that the histopathology results that come back on the lump are good news, but being a skin lump, there's many, many things it could be.
The lump could be something simple like a cyst or a pimple or wart, or it could be something nasty like a skin cancer.
Good morning. You ready? Put you in bed, hey?
Tilly will sleep off her anaesthetic before being returned home to her anxious family.
You did such a good job today. Everything went real smooth. So the next time we see you, Tilly, will be when we report the results and find out what that puggy pimple really is. Hopefully good news. You're all right, baby. You're all right. You're a good boy. Did you get into a fight? You've been scrapping on the streets. Hey, Jimmy.
As vet nurse Tiffany comforts Jimmy Chew after his surgery, it's time for the surprise Alex has organised. A visit from his owner, Bernadine.
Who's that?
Hello,
Hey,
boy.
who's that?
Oh,
Who's that,
hello.
Papa?
Hello, gorgeous. Oh, Jimmy. Hey, how are you? Oh, darling, you're a big nut, boy. Hey, how are you? Hey, good boy, Jim. Good boy. Here, come and sit with Grandma. Come Come and sit with Grandma. When I first saw Jim, my heart sunk. Oh, God, Alex.
I know. It's a bit of a shock.
I'm quite shocked to see the extent of Jim's wounds. I knew that they would be bad, but I didn't know that they would be so large. Good boy, darling.
But he's such a lucky dog. It could have been
Oh,
much
absolutely.
worse.
Yes, it could have been.
The good news is that these will heal.
Yes,
This is
of
just the
course.
skin. So we'll give him another day.
Thank you.
Keep his pain relief up.
Thank
and
you.
what we want to really see is that we want him to be eating a little bit, feeling a little bit happier.
Yeah.
He'll be much happier when he's at home.
Yes.
So fingers crossed we can.
Of course.
We can do that tomorrow.
But your mum will come and see you tomorrow, sweetheart. Hey? This is my daughter's dog. Frankie was quite anxious just to know how much trauma Jimmy did go through. So I had to come and see Jim. At home, they are both inseparable, and to have them separated is a little bit sad. Good boy, Jim.
Jimmy really is the light of Frankie's life. So she relies on him. It's really important that we get him home, back to her.
All right, mate. It's time for you to go. How are you?
In Bondi, Pedro Possum is finally well enough to be released from Kate's care.
Let's put you in your little pouch, like that. There we go, mate. Every day your eye gets a little bit better. Hopefully soon you'll be able to go back to the wild. Still a long road ahead for Pedro. He's going to have a lot of rehabilitation. You're a cute little guy. What's next for Pedro is getting him to a carer. I've called June. She's a lady that takes all of the possums around this area, and she is the best person to rehabilitate Pedro to a point that he's able to go back out into the wild.
Let me have a look.
He's in here. He's in here somewhere.
Where are you?
Oh, there he is.
I've been caring for ringtail possums for about 7 years. I really like the possums. I mean, they're cute, furry, and gentle. Yeah, they're lovely animals. Young fella.
Do you see his eye?
Oh, yep.
So this is heaps better than what it was. He just needs a little bit of time. I've got some little drops here.
Okay.
Just some drops. I'm just going to get you to use those just when you see that it's sore, just so that you can keep it lubricated till it gets better. But I expect it to get better fairly quickly. I want it to be better. It's like in the next sort of week.
Okay.
Look after him.
I will. I promise. I'll let you know. Yep.
I'm super attached to him.
Yeah, I bet.
All right, mate. May the force be with you. Good luck. Good luck. June is so dedicated to the animals that she cares for. So I'm confident that it's going to heal. And Pedro is going to get out there and he's going to get back into the wild. See ya.
A week after surgery to remove a worrying lump from Tilly's forehead, Alison and Audrey are making an important follow-up visit.
So we've come to see Tilly today to have a look at the wound on the head after we removed the lump last week, see how that's healing, and of course to deliver those results to Emma as well. Hi, Emma. How are you?
Hi, Tilly. Nice to see you.
Nice to meet you.
Come on in, come on in. I've been really waiting to find out the result of what that lump is, because obviously I'm really concerned that it might be something malignant or not good, and we don't want anything to happen to Tilly because she's such an important part of this family.
How's she going since our visit?
She's been okay. She's desperate to get this cone off.
You've done well keeping that on. And she's all back to her normal self.
She is, her playful little self.
All right, so let's have a look how that area is healing.
Looks
and
good.
that surgical site's healing really well. So the results have come back from the lab, from the histopathology report. And the good news is it's a benign lump, so it's called a cutaneous squamous papilloma. And what that basically means is a benign wart-like lesion. So it's not going to cause any problems. So big sigh of relief there.
That is a huge relief, such a big relief.
Good news.
Fantastic news about Tilly's results. Feeling really relieved, one, that it's off, but two, that we know that it's nothing that we need to be worried about.
I think she looks great. What do you think, Mum?
I think she's looking amazing. The fur's grown back and Tilly's starting to look like her old self, which is wonderful.
And I guess the most important question is what Tilly thinks.
Oh.
Hey? And look what we have here.
Can we get your tick of approval? No more lumpy head.
Tick of approval or lick of approval?
What do you think? Lick of approval? That's a lick of approval.
I think Tilly was really happy by the results today, so I think she'll be happier when that cone comes off and is going all back to normal.
Hello, Jimmy. Hello, mate.
It's been 2 days since the badly bitten Staffy Labrador cross was brought into the Animal Emergency Service on the Gold Coast.
Hey, still so sad.
A vicious fight with neighbouring dog Bruce left Jimmy Chew with over 100 stitches from tip to tail.
I know something that will cheer you up. Let's get you home.
The 7-year-old has now recovered enough to be reunited with his loving owners, Bernadine and her daughter Frankie.
Okay, we've got to go up this way.
I've had Jimmy since he was 8 weeks old. He was a present to me and he's been absolutely the best thing for me. I can't wait to get Jimmy home, Mum. I suffer mental illness and he's been with me the whole time through the worst. I wouldn't be here if Jimmy wasn't here.
Hello, mate. Hello. Hello.
There's your mum.
I think he gave a little smile there. When I see how much Jimmy means to his family, thank goodness, because it could have been so much worse.
Hey.
You must be so happy to see your boy.
I am, thank you.
If we hadn't been able to get Jimmy home to his family, then, gosh, I don't even know how they would have dealt with that.
Look at all your stitches, mate. You got too many. Hey. Oh, I love you too.
Thank you so very much because my family's back together and you can see the love between Frank and Jim. It's a very, very special bond. And I thank you so very much for looking after Jimmy and Frankie.
Oh, he just means the world to you guys. I can see that.
Yeah.
It's great to see Jimmy go home today.
Come on, mate. Let's go.
He's still got some healing to do, but I think being at home, getting that special TLC from his mum and his grandma, that is going to make all the difference for him. You stay out of trouble, my friend. Hey? And I'm sure he's going to have a few words to Bruce through the fence. He didn't get him this time.
See you now. Bye. See you, Alex. Go for it, Jim.
Come on.
Hello. Little princess here.
She's a bit thirsty.
Yeah, she's a bit stressed, isn't she?
Yeah, she's very stressed.
Okay.
At the Animal Emergency Service on the Gold Coast, brand new mum Princess has been brought in to see Dr. Alex Hines by worried owners Kira, Fardeen and their daughter Zainab.
I think she's squashing on over here.
Oh, is she? Okay, I might just pop this little guy out. Getting squashed back there, mister.
Earlier today, a heavily pregnant princess went missing.
Usually when I go to work every day, I come out and Princess come to me. And this morning when I asked Kira, where is Princess? I haven't seen her.
It was quite a few hours actually, and then I got quite concerned because she was due to have the babies. Labour's hard, so I wanted to be there with her. So I was a bit stressed.
Yeah, I found her in the backyard and she had the baby.
Princess is just 8 months old and the family was immediately worried the birth may not have been straightforward.
My husband thought that her stomach felt quite hard and her belly was moving a lot.
Let's get her through and have a look at her.
We're still worried that she has a baby inside or maybe the placenta, I'm not sure. It looks like she's like having contractions or something.
Okay.
She seems like distressed, or I don't know if that's normal.
This family have brought their little princess in. They're a little bit worried, and to be honest, I'm a little bit concerned as well. Maybe she's still got another little kitten in there. For a young mum, she's done
a good job.
Really great job, hasn't she? Look at them all.
So proud of her.
Excuse me, little guys. I need to just have a feel of her tummy, so I'm just gonna... They're attached tightly. They're having a great feed. They're strong. Whoa, sorry, kids. Sorry, took away the milk bar. Looking at Princess, she is quite young to be having kittens, and she does seem to be a little bit distressed. And certainly it's quite firm in her belly. And it can be difficult to work out sometimes, is it just her uterus that still feels quite firm because that's going to be larger than normal. There is something very firm in there. Is it a kitten? I don't know. I'm going to pop you back in with your babies for a minute. But if there still is a kitten in there, it's been almost 12 hours since the rest of the litter were born. We're going to need to do something pretty quickly.
ready for another big day. Another big day in Sydney City.
Mobile vets Doctors Alison and Audrey Shen are on their way to their first case of the day.
Whenever we get a call out to a new patient, it can be a little bit nervous. You've never met the owner before, you don't know how the animal is, what to expect. So that's always quite exciting, but also a bit challenging at the same time.
Owner Laurie has called the Shens because she's worried about a lump on her beloved Spanador, Hunter.
Hi, Laurie.
Oh, hi, come in.
Hi, this must be Hunter. Hi, Hunter.
I've had Hunter since he was a puppy and he's 8.5 now. He's just fantastic.
So excited to see us. Hey,
Very
nice
friendly.
to meet you. Hunter's just a big teddy bear. He's adorable. Big smile on his face.
He's my best friend and he's got me through some really hard times. When my mother was terminally ill, he got me through that, more so than friends, and he means the world to me.
So what's the problem with Hunter today?
I noticed a lump growing and it's got bigger. Yes, yes. There's one here, that big one under there. If he lies down, you can really see it.
Oh yes, I can feel it's quite big.
Prominent. And there's another one just starting over here. It's quite small.
Oh yeah, just behind there, just behind the left armpit. Yeah, it's a bit smaller.
It is.
Yeah.
Yes.
Yep.
The lump on the chest is a little bit bigger and a little bit firmer, so I'm a little bit nervous about.
Has he had any lumps and bumps before in his lifetime? No. Dogs can get all sorts of cancers. Until we do more testing, we don't know what we're dealing with. I worry that it might be cancer. And I feel, Hunter is so important to both my son and I. The thought of losing him, it's more than I can't go there. He's a member of the family, Hunter. He's very important.
Good girl. Don't you jump out, little miss. You stay in there with your family.
Back on the Gold Coast at the Animal Emergency Service, Alex is taking 8-month-old Princess for x-rays to find answers about a large mass that has been felt in her belly.
If there's still a kitten in there 12 hours after the rest of the litter's been born, then that kitten will be losing its oxygen supply. So time is ticking. There we go.
Alex is being assisted by vet nurse Tiffany.
There we go. This is Princess. She has had 5 little babies and her family are really worried that she might have more kittens in there because they've seen her belly contract. Okay. And I can feel something in there. We're going to take an x-ray and that'll tell us for sure if there's any babies left in there. Really hope there's not a kitten stuck in there because I don't want to have to perform an emergency cesarean on Princess. She's still so young and that's not a road we want to go down.
Alex is reluctant to keep Princess separated from her precious babies for too long.
I think having the babies out of sight is actually better for her. Yeah. When she can see them, she's worrying about them.
Good girl, sweetheart. Good girl.
Okay, I'm taking an x-ray.
1, 2, 3.
So the x-ray goes up and Tiffany and I just look at each other. Oh my goodness.
Look at that.
It just wasn't on our radar.
In Sydney, mobile vets Alison and Audrey have been called in by owner Laurie to check worrying lumps on 8-year-old Spanador Hunter.
We're going to stick a little needle into the middle of each lump and hopefully collect some cells. We'll
Yes.
spray that onto a slide and then I'll bring it into the van and look down the microscope.
Okay.
All right, so I'm going to shave a little bit of hair.
The Shens hope by examining the sample, they can rule out the possibility of the lumps being cancerous.
Good boy. Oh, you are a good boy. Good boy. All right, that's it on that side. So when we're taking the fine needle aspirate of the lump, we're trying to get some cells there to get an idea of what type of mass it may be.
It's a good test to do on the spot and sort of get a little bit of an idea of what we're dealing with.
Okay, we'll get you to lie down the other side so Auntie Addie can see that other lump. Come on, Precious. Lie down. Oh, good boy.
There you go.
Abscess. Oh, it's tickling.
There you go, Hunter. That's all right.
Hunter's just lying there. He's really cooperative.
Really a star patient today for us. Well done. All right, so I'm just going to spray this sample onto the slide and hopefully we've got some good cells in there. I hope it's not anything sinister.
Yeah. You're a special part of the family, aren't you, buddy?
Sure are. My biggest fear that Hunter would be diagnosed with cancer. He's just my great companion. I couldn't bear to lose Hunter now.
Come on, little boy, we're going to see Dr. Kate.
At the Bondi Vet Hospital, Jen and Richard are bringing in their ageing Pomeranian Howie to see Dr. Kate Adams.
Howie came to us blind in one eye, and I think that's what attracted him to me, because he wasn't perfect, but he had such a smile on his face that I just fell in love. Our old dog Harry died 10 years ago, and we weren't going to get another dog, and then Richard and I went on the internet and found another dog independently, and it was the same dog, so that's how Howie became part of our family.
Hello, you guys.
Oh, Dr. Kate!
Look at you. I fell in love with Howie as soon as I first met him, with his little one eye. I think actually at that point I felt like he was wearing a patch, and it just melted my heart. I thought, this dog is so special. What's been going on? What's happening?
It's a bit of a cough. I've got a video of it that I took, and I just wanted you to have a look at it because, yeah, it's worrying me, and it's a hack.
Give us a look. Oh my goodness, that's less than ideal. Oh dear. It's a bad cough, isn't it? You watch yourself, look at you, coughing away there. What I can see from Jen's video is that Howie has this hacking cough. It's not looking good. It looks like it's making him uncomfortable. It looks like he's in distress as he actually coughs, and it looks like he's battling for air at times. Is it almost like in a fit of cough? Like does he sort of cough for 3 minutes sort of thing, and then it stops for a little while, and then it's in a sort of a fit of a cough, right? Yeah. And when was the first time that you noticed it start to get worse?
About a week ago, I suppose.
Okay.
Yeah.
If you don't treat a cough and you don't treat a cough as serious as Howie's, you can develop things like pneumonia very quickly.
We don't want him suffering. We don't want him in any distress. We just want him to be the happy little dog that he is and that we love.
I'm not seeing any little skeletons there. We'll take another view because we need to be sure.
At the Animal Emergency Service on the Gold Coast, Alex is performing x-rays on 8-month-old Princess after concerns the new mother may have a kitten stuck inside her.
It's good. There's no babies in there. That's great. No skeletons. I can see that she's got... Look at that.
The results are not what they were expecting.
I think what I was actually feeling...
It's food.
It's food. This is all food there.
There's no kitten in there, but there is just a lot of food that she must have woofed down straight after she had those kittens.
That's really good news for Princess, because it means that we don't need to worry about getting more babies out of there. She's just got to deal with the 5 that she's got. And maybe no dinner tonight.
On a full stomach.
Yeah.
So now that we've given Princess a clean bill of health, I'm going to look at these 5 little kittens because we need to make sure that they're okay. She looks super healthy. I know. What are you? You're like a little tiger. Oh, we're going to escapee.
You have an escapee.
Well, where are you going? A runaway already. We're going to look at their hearts. I'm going to make sure that they don't have any congenital deformities. Listen to your chest. Okay. You don't know what you're complaining about. I saw you had a big feed. I love this part of the job. They are so cute. Their little faces, their little squeaking noises they make. How adorable. How adorable are you?
We'll call that one Alex.
Yep.
You're just sleeping, darling. They're okay. You can go in a second.
Mum's getting a bit worried there, isn't she? 4 of them look fantastic. They're a healthy weight, about 100 grams or so. They're really strong and vigorous.
You're a really good girl.
You're a clever mum.
But the last kitten has Alex concerned.
There's something there we need to be worried about. This little guy is going to have some challenges.
In Sydney, Alison and Audrey are in their mobile clinic examining cell samples from 2 suspicious lumps from Spanador Hunter.
It's got that glistening,
oily droplet look.
Yeah, so it looks like fatty droplets.
Let's stand it up and have a look.
Yep. We're looking for exactly what type of cells and whether there are any nasty cells that are in there, in particular in this case. So that will show up really nicely on magnification on the microscope today. If it is cancer, it can be life-threatening.
Inside, owner Laurie is terrified about what the Shens might find.
We just hope it's good news, hey? I worry that it might be cancer, and I'm hoping they can come back and say there's nothing worrying under the microscope. But if it's a worry, I'll be extremely anxious. Hunter means the world to us, really.
In the mobile clinic, Alison and Audrey have finished their examination.
So we're seeing some cells there, which gives us a good idea of what it is. So I think now we'll go give the news to Laurie.
Back at the Animal Emergency Service on the Gold Coast, Alex is examining a very small kitten.
This one's actually a lot smaller than the others. You're what we would call the little runt, but you got big lungs. This is the one they'll need to keep an eye on because those other ones are so strong, and in that situation, this little guy could end up missing out. He's going to be pushed out of the milk bar by his much stronger siblings, and so the family are going to need to keep a close eye on him, and he might need some extra help. So we've got 5 healthy babies, 1 healthy mum, no hidden surprises in there.
Great.
I think we get back to them and let them know the good news.
Yeah, great.
Oh, you're like a little tiger. Hello.
Hi.
Got your little family back.
Hello.
Back.
There we go.
Sweetie.
Now, I've got some news.
Okay.
And it's good news. There's no more babies in there.
Okay.
Okay. But what I can feel in there, what you could feel, is actually her stomach full of food. So she has an enormous stomach.
And that's all it is?
Yes. So if something is in the belly and it's taking up a lot of space or in the abdomen, it can actually restrict their breathing, and I think that's what's happened with her.
Okay. I feel a bit silly.
Look, you did the right thing to bring her down.
I wouldn't have been able to sleep if I didn't bring her in. I would have been worried all night, so.
I did give them all a really good check over, and they're all in great health.
Awesome.
There is one little chap that's smaller than the others, you might have noticed. So this little guy, he's quite a lot smaller. So when they've all had a feed, it might be worth just making sure that this guy gets time at the milk bar by himself.
Okay.
Okay, yep.
I love her. She's a really good cat, really friendly. She's my princess.
The kittens will stay with Kira and her family until they're old enough to go to new homes. But Kira has already decided the tiny boy will stay with his mum.
It's like hard to keep all of them, but we can't.
Right,
Thank you so much.
Nice to meet you.
Really appreciate it.
Nice to meet you. Thank you so much. Bye.
Thank you. Take care.
Let's have a look at you, little groover. Let's see what we can do.
In Bondi, Kate is assessing Howie's chronic hacking cough.
Let's have a listen to that chest shook. Can I have a listen? Ready? Very crackly down there. When I listen to Howie's chest, I can hear that his lung sounds are increased. There's crackles, there's wheezes. There's a whole bunch of sounds there that really shouldn't be there. It's really important that we try and control this cough as much as we possibly can. And the second part is that it does affect his quality of life. You know, it means that he can't get out and play as much as he normally would. It means that he has to worry about breathing. If you don't treat a cough and you don't treat a cough as serious as Howie's, the chances of him living are actually pretty slim. I haven't quite thought of an absolute solution just yet, but I have some ideas on this.
I'm sure you do.
But you're gonna have to leave it with me because it's some things rolling around at the back of my head that I think, is this a possibility? Maybe. I don't want to leave this too long because it's pretty critical that we actually get a solution pretty fast. Hang 5 and I'll get back to you on it.
Okay. Yep.
Yeah, anything Kate can come up with, be great. You know,
Yeah.
any suggestions really.
As long as he's comfortable and happy.
Yeah.
In Sydney, Alison and Audrey are about to give owner Laurie Hunter's test results.
Good boy. The lump is growing. There's always this warning bell in your head. You know, is it a nasty lump? Is it a tumour? Is it the C word? So we sent up the slides.
Yes.
We had a look. We've got some cells there. The good news is it's a benign lipoma, so it's not a nasty tumour. It's an oily fat deposit, and it feels like a thick mass, but it's just fatty tissue. So it's good news.
It is.
Okay.
Thank you.
Yeah.
I feel just a monumental relief because I've felt terrible that I haven't, because of other things that have been happening, that I hadn't followed it up sooner. And, you know, it's a real relief.
Oh, I know. Hey, you're a lucky boy, aren't you? Mummy was so worried. Delivering results like that to Laurie is so gratifying. It's almost a sigh of relief for us and for her, and I'm just so happy we can give her good news. Now, the only bad thing with those kind of lumps is the position that it's in and how much it grows.
While Laurie is relieved the lumps are not cancerous, the Shen sisters are concerned the lumps could continue to grow and become very uncomfortable for Hunter.
I think it's peace of mind to get them.
It is.
Yeah.
I'd rather have it out.
So we can pick him up on Wednesday, do my surgery, and then drop him home.
Okay.
Yeah.
Thank you so much.
It's our pleasure.
It's really
glad to give you good news.
Good news.
Yeah.
Yes. I can't wait. I want them both surgically removed. And we'll have a healthy Hunter back.
On the Gold Coast, Alex is catching up on her clinical notes, while prankster Dr. Gerardo Poli has found a new arrival.
Aren't you a handsome man, eh?
And Gerardo wants to introduce the lively rodent to Alex.
Sure, Alex like you. Alex likes handsome men.
Ooh, who is this? Oh my goodness, give me a fright. Hey, little guy.
G is renowned for playing pranks around here, and he thinks it's quite funny to come and put a rat on my shoulder. Some people really don't like rats, but I think they're gorgeous little creatures. What's wrong with him?
He's a stray.
Stray?
Yeah.
A stray rat? Oh, he's gorgeous. You're going to sit up there for a while. Someone must be missing him. He looks really healthy.
He's a cute fella. He's really, really nice.
What are we going to do with him?
Alex and vet nurse Miff check the local lost pet sites to see if anyone is looking for a missing rat.
There's definitely no rats that have been listed. What are you doing, mister?
He's checking out Facebook, seeing how many followers he's got.
Oh, I hope nobody claims him. There's a lot of big hearts around here, and one of the biggest is our vet nurse, Miff.
Precious little angel.
I think secretly she's fallen in love with this little rodent.
He's a special rat. You are.
And she's made it her mission to see if there's a family out there who's looking for him.
I'll keep an eye on it anyway.
In Bondi, Kate has been researching a solution to help Howie with his chronic cough. And today she's delivering a special package to owner Jen.
Hello, how are you?
I'm well. How are you?
Well, I've got something for you both.
Okay, come through. I have no idea what Kate's got in store for us, but I'm sure it's something great.
Howie's chronic cough is a real concern as he's battling for air. If left untreated, it could quickly develop into pneumonia.
I've got something that actually might help our little Howie here with that cough. Might help him get a little bit more sleep. Well, let's have a look what's in here.
Oh, let me see.
Yep, I know. Okay. So this
is
a little spacer.
Spacer.
And this is a little Pomeranian-sized mask. That just actually fits onto the end of this. Right?
Wow.
Okay. And then what we've got is this little inhaler. It's a human inhaler.
Human stuff, Howie.
Human stuff, just like little kids get with their asthma. Okay, and we pop that just on the end, like so. And then his little face goes into here. Right, you do 1 puff twice a day.
Right.
And then let him have a couple of breaths.
Okay, we can handle that.
Kate hopes that her solution will open up Howie's lungs and give the old Pomeranian a new lease on life.
Ready? Here we go.
Yep. There we go, Groover. Come on, Groover.
Wait a minute. Okay. And a puff.
And a puff.
1,
couple of
2,
breaths.
3, 4, 5.
There we go.
It's over.
See? When Howie inhales, the medication, essentially it acts as a little bit of an anti-inflammatory. It helps open up all of those really small little airways so that Howie can actually get more oxygen into his lungs. It also stops the mucus build-up in the lungs, so it means that Howie's not going to feel this constant need to cough. We're going to monitor him for the next couple of weeks.
Yes. Hopefully it'll do the trick, though.
Hopefully we'll do the trick. What do you think?
Yes, she should. Thank you, Dr. Kate.
It's looking particularly cute today.
He is. He's an old dog, but if we can improve that, his, senior years, well, that's what we're going to do, and we're going to make it as comfortable as possible for him.
My good boy. You'll be back this afternoon and you'll be all better and the girls will take good care of you.
In Sydney, it's an emotional day for Laurie as she waits for the arrival of Alison and Audrey.
We're here to pick up Hunter for his big day, a big day of surgery to remove 2 lumps. I think Laurie's going to be a little bit anxious.
Yeah, she's going to be very nervous today, so we'll keep updated every step of the way.
Here they are. Come on.
Although the lumps are benign, they're causing Hunter discomfort and need to be removed.
Hi, Laurie.
How are you going?
All ready for your big day?
Big day.
Nice to be amazing. You feeling okay about it?
Yes.
Yep.
I'll be glad when he's home.
Of course.
So we will take him now, bring him into surgery,
Okay.
and then once he wakes up, I'll give you a call, and then
Thank
we'll bring
you.
him straight back.
Thanks very much.
All right, buddy?
Yes.
You're going to be a brave boy today? And let's go. Come on, buddy.
Come on, Hunter.
Come on, Hunter.
There we go. Bit nervous. Hunter's second time away from us since he was a puppy, so I'll miss him.
Hello, crow. Got a crow for you.
A crow.
In Bondi, Kate's next patient is a rescued crow.
Let's go have a look at him. We'll take him into a consult room. I love crows. They were actually one of the very first birds that kind of got me through my own fear of handling birds because they're so big. They are very flappy and they are very loud.
Got him.
While Kate has clearly overcome her crow phobia, vet nurse Elizabeth is still wary.
I know you don't like crows.
Birds in general.
But he's nice.
No, bless him, he's cute, but
He is cute.
don't want it
Just
near
think
me.
of him like a little puppy or a kitten, except he's a crow. So many people are really afraid of birds, but like all things, you have to look for what's lovable about them, and their personalities really shine through. I think we should call him Colin.
Oh, cute.
Colin the crow.
Colin was handed in by a local resident who found the flightless crow in their backyard, being stalked by the family cat.
Elizabeth, do you think you might be able to just pull that wing out for me? Yeah. It's got a little tiny injury on the end of that wing from flapping around. Let's check the other one. Just grab that wing for me. Pull that out for me. Let me have a look. Okay. Perfect. That's good. Perfect. So other than that little nick in his wing there, he looks to be in reasonable condition. I think actually the only reason he's actually here is because he's actually just trying to learn to fly. And I don't actually think he's sick, which is a good thing. You're not sick, are you? You're just a baby. Colin is just a healthy baby crow. He's got the black eyes and he's also got some characteristic baby feathers. He's not as cute as a regular baby, but like, come on. So what happens with these guys is that they don't seem to be able to fly when they first get out of the nest. And what happens, they sit on the ground and their mum and dad usually are around trying to teach them how to fly, and then people mistake them for sick birds and then they pick them up.
Bird napped.
Bird napped. It's exactly what you were. So I bet this guy actually has a mum and dad somewhere waiting for you. Do we know where they found him?
Yeah, North Bondi.
That's great. We might be able to find your mum and dad. Put you back. No.
Before Colin can be released back into the wild, there is one more important lesson he needs to learn.
Without being able to fly, we're not able to just release him back out, because the reality is he's going to stay on the ground, and it means that the chances of him getting attacked by a cat are pretty high. Calm down, Chook.
We'll just do a quick blood draw for that, get a heme-Q.
And you're going to place that catheter in as well?
I can do that.
And
then
At the animal hospital in Perth, Dr. Peter Ritchie and vet nurse Michelle are awaiting the arrival of a very special patient.
Today we have a patient coming into the clinic called Elvis. Hey Elvis. There's nothing wrong with Elvis at all. He's completely healthy. The reason he's coming into the clinic is to donate blood. Animals need to give blood for the same reasons that humans give blood, to provide life-saving medical therapies with blood products to patients that need them.
We have approximately 40 dogs and 20 cats on our donor register, and each of those animals donate approximately 4 times a year.
His owner Jesse has brought Elvis to the clinic as part of his regular visits to give blood.
Albus is a 70-kilogram Great Dane. I let Albus give blood because I understand as a vet student how vital it is for other dogs who are sick and need it.
Peter aims to collect 500 grams of blood from Elvis today, with the procedure usually taking less than 10 minutes.
Elvis is one of the most ideal blood donors because of his size. He has beautiful big veins that allow us to access his blood. He is a really calm and patient dog.
Good boy.
Good boy, Elvis. We need animals that are the appropriate temperament to go through the process, and Elvis definitely is.
Good boy. Yeah, that's good. There we go. That's beautiful. He's been such a star.
Almost there.
Blood collection done, it's time for Elvis to get his reward.
You're in treat. Elvis was a very good patient as always, and he's saved another couple of lives today. Good boy.
Donor blood is processed into 2 products, red cells and plasma. So Elvis's contribution today has the potential to save 2 lives.
Had a good meal?
It's really rewarding. You get notified every time your animal's blood gets used for someone or saves someone's life. You get a card in the mail. It's a great feeling to know that my dog is helping others.
At the Vet Animal Hospital in Sydney, Hunter is being prepped for surgery by Alison and Audrey.
Good boy, Hunter. So Hunter's come into the hospital today to remove 2 lumps, one of them being quite a bit larger and causing some discomfort.
With Hunter's advancing age, vet nurse Bree will be keeping a close eye on the 8-year-old during surgery.
Good boy. There's a higher risk with him being an older patient, so making sure that he's well monitored throughout the whole anaesthetic is really important for us.
The first of Hunter's lumps to be removed is the largest of the 2.
She's got a couple of strands.
Just breaking down the attachment to the muscle, and then it should remove quite nicely for us. Okay, so that's our capsulated lipoma there. So it's a nice ball of fat sitting in a firm capsule. It was attached to the muscle wall on one side, but came away nicely. So we'll move on to the other side. All right, are we ready to flip?
With the first fatty lump successfully removed, Hunter is repositioned for the second part of the surgery.
1, 2, 3. All good? Yeah. There it is. That's our smaller mass there. encapsulated as well. That one came out pretty quickly there. I'm happy with how that's come out. And now we'll close up and wake him up. Hang on a minute. There looks like there's another lump underneath that one.
To the Shen's surprise, they've discovered a third hidden lump that no one was aware of.
Deeper down, it sort of just popped its head out when we removed that lump.
It's all lipoma, just sitting right underneath.
That's a lucky find.
There was 3.
There was actually 3 lumps.
The third lump is small, but it's proving to be the trickiest to remove.
This one's a lot deeper, so there's a little bit more bleeding with this one. You can see his heart rate's going up a little bit.
We'll break that off.
It's the secret lump.
Under the lump.
Poor Hunter, it's been a big day for you. Hey, buddy.
So all 3 masses are out. So we will stitch Hunter up now and get him ready for home time. So I think Laurie's going to be in a bit of shock to find out that there's a secret third lump there, and I think there'll be a relief.
It's actually a good thing that Laurie chose to get those lumps removed, otherwise he would never have known it was there.
Yeah, and removed now, because that could potentially have grown to a size even bigger than the first one. Good boy, you did so well.
It'll be a few hours before Hunter is fully recovered from the anaesthetic, and if all goes well, can be taken back home to owner Laurie.
You'll be feeling better in no time.
Come on, Cole.
In Bondi, Kate and her noisy rescue crow Colin are on the move.
Hey!
Hi.
I've got something for you.
What have you got for me?
I've got a baby crow.
Oh, lovely. Come inside.
Kate has brought Colin to the home of wildlife carer Gillian, hoping she'll be able to teach the youngster how to fly so he can be returned to the wild.
All right, little buddy, hang on. He's pretty cute. He's very feisty. It's really important for Colin to find his family again. He's just a baby and he still really needs his mum and dad.
Did you examine him?
Yeah.
Gillian is a volunteer carer for Australia's largest wildlife organisation, Wires.
He's flapping really well and he's perching really well. I'm going to give him something to eat and then I'm going to put him in my aviary. Come on, baby, come on. Once he gets a taste of it, he'll be fine. Let's just put it down your throat a little bit. Is that yummy? Is that yummy? Yeah, that's
delicious.
Yummy. It's yummy. We'll have another one. See, they learn very quickly. I've always loved birds and I've been doing it for about 8 years. It is a passion. One bird that I can release, that just makes all the difference in the world. I think you've had enough. You had enough? I don't think he'll take any more. Okay, so I'm going to take him outside. I'll put him in my aviary.
Gillian's backyard aviaries provide temporary homes to dozens of species of urban birds until they're ready to be released.
When I can see that he can fly from the ground to the top perch, I'll take him back to his parents.
Yeah, look, he's getting used to it. He's going to give it a crack.
Starting to
he's
flap.
trying.
Yeah, he's trying.
Come on, Cole, you can do it.
I don't think it'll take him long to fly. It'll take him a couple of days because he's already flapping.
Once Gillian thinks Colin is ready, the plan is to release him close to the place where he was found.
Is his mum and dad going to wait for him?
Usually the parents come very, very quickly.
Oh, that's great.
They recognise their baby and they recognise the sound and they come. You see that bird going out into the wild and you see it soar and you think, it's just all worth it. You say bye-bye. Bye-bye, Dr. Kate.
Good luck, Cole.
We've had 2 bags of plasma to 3 bags of, well, this is the 3rd bag of cells. We've probably had more crystalloid than I would have liked.
Yeah. At the animal hospital in Perth, Peter is monitoring 7-year-old Leo. The pointed cross is recovering after emergency surgery to remove a nasty tumour.
We have a very critical patient. He's a dog who has lost pretty much his entire blood volume from a tumour that has been bleeding in his abdomen, and he is being kept alive with the blood donation that Elvis gave us.
Great Dane Elvis is just one of a number of blood donors at the clinic.
Without that, this dog would have already passed away.
Now with the surgery over, the team is monitoring Leo's vital signs, but he's not responding as well as they'd hoped.
His blood pressure.
With Leo's condition deteriorating, his owners Michael and Elise are called in.
About 2 weeks ago, he started to get quite extreme lethargy and went off his food, so rushed him down to get looked at, and they found a lump on his liver, which is expected to be cancerous. So
He's stable, I think, but yeah, it's not looking good. So.
Unfortunately, Leo is not responding well to treatment. Although Peter is still hopeful the blood transfusion may be able to make a difference, Michael and Elise are prepared for the worst.
It's just a tough time. You just don't expect it. He was bouncing around, you know, not that long ago, and yeah, now it doesn't look like it's going to be long.
Laurie's going to be so happy to have Hunter home. This is the good part of our day.
Yeah, best part.
In Sydney, Alison and Audrey are about to reunite Laurie with her beloved Hunter after surgery to remove 3 nasty lumps.
Hi, Laurie. How are you?
I'm good, thanks.
You ready
How
to
are
see
you?
your baby boy?
I sure am, yes.
Ready, Alison? Yes. Yeah, here he is. Look at that smile. Hey, you happy? And your tail's wagging. Hey, you missed your mum. Tell her all about it, hey?
I missed him. I was excited. I didn't know how he'd be, whether he'd be really out of it or in a bit pain.
We actually found 3 lumps. So there was that big one, and then underneath the smaller one was actually another lipoma. So we removed all of them, and they're all out, so should recover very, very well.
You ready for your cone of shame now? Got one more thing.
And it's just to stop him licking it, okay?
And it just stays
on till I see him again for his
Right.
stitch removal. You can take it off to give him a bit of a break, but just make sure you're watching him. And if he does lick, it goes straight back on.
Hunter's recovery from now is basically to sleep off the anaesthetic for the next 24 hours and keep those wounds or those stitch line very nice and dry.
So Laurie's got a big part to play in the next couple of days to keep him quiet, keep him happy, and keep those wounds nice and clean.
Come on, buddy. Come on, Hunter.
Good boy.
Watch your step. Oh, good boy.
Good boy.
There we go.
Hello, Hunter.
Come on this way.
Up you come. Good boy. The 3 lumps have now been cut out, and that's a massive relief for me. Thank you so much.
My pleasure.
To know that Hunter is well. They did blood tests on Hunter, his kidneys and his liver. They were really thorough, and Hunter's got a really clean bill of health, so that's a big relief for me.
hello, he's a good boy.
Back in Perth, Peter has some incredible news about Leo, the dog who had a tumour removed from his abdomen and was not expected to live.
So we're about 24 hours since we last have seen Leo, and there's some great news. He's up and about and looking a lot brighter than he was yesterday. Good boy. He's recovering well, and thanks to the blood products that he's had, he's looking a lot better. We've got to be very thankful for our surgeons and the hard work that they've done, but we've also got to be extremely thankful for Elvis and his blood donation, because without that, Leo wouldn't be here right now.
Good boy.
Leo will be kept at the hospital for several more days to monitor his progress before it's hoped he can go home with his family.
You want to come and live with me?
Yes, you do.
3 days later on the Gold Coast, no one has claimed the little stray rat, and vet nurse Miff has decided to adopt him.
I've chosen to call him Bruce Wayne. Bruce is going to come and live with me in my menagerie.
Miff is besotted with the stray, and Alex and Gerardo are delighted she's giving him a home.
Someone's found a friend.
Who's this, Bruce?
He certainly looks like he's really taken to you.
Yeah, he wants to live with me.
One lucky little boy.
Oh, I think I'm the lucky one.
It's a good match there.
He's precious.
I'll have visiting rights.
Okay, sure.
I'm happy to hear that you take him. He's a gentle little fella.
He is gentle.
He's pretty special.
Got a cool cage, bought him a hammock.
Are you serious?
A rat hammock.
Wow, Howie, look. There's a whole big gang of dogs coming.
It's been a week since Howie has been on Kate's innovative inhaler regime to help him with his chronic cough.
Hi.
Devoted owners Jan and Richard are thrilled with the results.
Since Howie's had the device, it's really improved him dramatically. He doesn't cough as much, well, hardly ever now in the mornings. We give it to him twice a day and yeah, it's good.
Wow. What do you think of that, little boy? There's a big difference in Howie's behaviour. Like, he's not as sluggish and he seems happier and more content with life.
Yeah, for sure.
You're much better. It's so
He's
good.
a lot better.
He is.
Aren't you, little bloke? Yes.
Dr. Kate's been wonderful. Hey, How?
He's an old dog, and anything that we can do that will, you know, help him along the way, we do. And this has helped him a great deal. So it's a win-win as far as I'm concerned.
Good boy. There we go.
Jules is here to see Dr. Danny Dusek, who's also his sister-in-law.
Harry has this great relationship with Danny, so it'll be an interesting thing. There is familiarity there, but Harry's about to learn what Danny really does. Danny is going to look at Harry, and Harry's going to look at Danny and say, hang on a sec, what are you doing with that needle?
Come on in, Harry. Hey, Julesy, how you going?
I'm glad I get a hello as well. Good to see you.
For Danny, pets are an important part of her family.
I've always been obsessed with my animals my whole life. They were my siblings, my best friends, the ones I told all my secrets to through high school. So I think I've always had that huge bond there. I love you. I do. So what's he been up to?
He's got a frenemy next door called Clyde, a black and white cat, and they biff on.
Oh dear.
Harry wins.
Did you?
So, in case anyone's wondering.
Harry's a bit of a cheeky cat. He's very affectionate, but he does like to show his affection with his claws at times.
He's just got a cut on his shoulder here, but it's
mate. Oh.
It's just a bit feral. Like it's got pus on it, and it's in an awkward spot where he can't lick it. Oh, it's disgusting.
Yeah, no, it certainly looks like a little ruptured abscess there. Yeah.
Jules, what a wimp. He's carrying on like a pork chop.
Oh, Jules, you got to toughen up.
He's not even bothered by it. Seriously.
No, he's a tough cookie. Now, I do want to check him over to make sure there's no other issues going on. He hasn't got any other wounds that are hiding.
Having a look through Harry's coat, I'm finding more and more scratches from all his rough and tumbles with the neighbourhood cat.
Got another scratch, there we go.
Cat bites can be really deceptive in that you will see a small little hole where that tooth has gone in, but potentially a huge abscess has spread along the length of their body.
Once we clip, we'll have a better idea. Because otherwise, if we leave it, it can become a systemic infection and get really sick.
Okay, well, we don't want that.
We don't want that.
Over in Perth, Dr. Peter Ritchie has arrived for his shift. When not working as a vet at Perth Zoo, he's on duty here at the animal hospital. Today, aggressive mini fox terrier Lottie needs urgent attention.
I can't really get up close and examine Lottie because she's far too ferocious and I really don't want to get bitten. Lottie has a super glue packet stuck to her, but it looks like there's a wound associated with that.
Owner Jonathan found little Lottie distressed when he returned home from work, but he was unable to remove the superglue.
I think it might have been on one of the tables, and she's quite adventurous, finding ways up onto tables. So she'd gotten a hold of a little tube and then ended up gluing some of her fur together, and then from her moving about, when it's set, it's pulled away out of her skin by the looks of it.
Peter can't tackle the glue until Lottie has settled down, but he's having no luck getting anywhere near the distraught little dog.
It's okay. It's okay. Be calm.
So it's time to change tactics.
My nurses are absolutely amazing and wonderful with handling animals, and sometimes a male is not the best person to come in when we have a nervous dog in here as well. So some dogs will respond better to a female.
Hello, it's okay.
So I'm calling in my wonderful nurse, Katrina, to give me a hand.
But with every passing minute, the superglue is hardening and the risk of the open wound getting infected increases.
I'm a little concerned that she's injured herself and cut her skin there. I can see blood, but the superglue packet itself is actually covering the wound, so I need to investigate a little bit closer there. If it is looking too nasty, we may need to take her to a surgery.
You're okay.
Michael and his daughter Zoe have arrived for their appointment at the local vet clinic. 10-year-old Kahoo seems lively enough, but has a worrying lump on his right eye.
It wasn't as bad at first because it was just smaller, but just was on the edge of his eyelid, but now it's like on the eyeball, so I'd say it is irritating for him.
Hello, Kahoo. Hey, always excited to see me, aren't you, hey?
Dr. Lewis Hunt has been looking after Kahoo for the last 5 years. Being a vet is a calling he's had all his life.
I don't think I decided to become a vet. I think I was always going to be a vet. My old man was a vet. I would stand in on consults and watch what he did. And I honestly don't think I was ever going to do anything else.
No.
So, nasty looking lump on that eye there. You can see that's rubbing on the eyeball every time he opens and closes that eye. And you can see the eye there is very red compared to the other side. Michael and Zoe are definitely doing the right thing by bringing Kahoo in. If left untreated, that lump could certainly cause long-term damage to that eye and get much worse. We're just making up some fluorescein stain here to try and get it into Kahoo's eye. He doesn't like to sit still at the best of times, do you, big boy? And then we're going to have a look at it under a blue light. And if there's any damage to that cornea, then we'll see it on that light. When I put that stain on Kahoo's eyeball, if it's clear, it's good. If it's green, it's not good. It means we've already damaged that cornea.
If Kahoo has scratched his eyeball, it could mean permanent loss of sight in that eye.
We're going to get this light and have a look at that. See that? You can see in the corner of his eye there, none of that stain's actually on his eyeball. So that's fantastic. Luckily for Kahoo, that eye is clear and there's been no damage to that cornea. So what actually is it? It looks very much like one of these cysts we commonly get in these little sebaceous glands that lie on the edge of the eye there. There is a chance that it is something nasty as well. Until we can actually remove it and send it off to the lab, we won't know for sure.
Kahoo will have to undergo surgery later this afternoon, and owner Zoe is understandably worried.
He's my dog, like of course it's scary. He's going under general anaesthetic, yeah.
Thank you.
All right, guys,
Thank
we'll
you
look
very
after
much.
him for you and we'll see you this afternoon, okay?
Thanks very much.
All right, Harry boy, we will need to clip up that area.
In Melbourne, Danny is examining her brother-in-law Jules' tabby after it got into a fight with another cat.
Oh, so you're going to give him
a
a haircut?
How do you feel about that?
Well, he's going to look ridiculous, and that reflects upon me, so we have to.
We do.
Okay.
13-year-old Harry has a nasty shoulder abscess that needs immediate care.
All right, Harry, we've got some reinforcements, so I'm going to swap around.
With vet nurse Hannah assisting, Danny first needs to trim away the fur to assess the extent of Harry's injuries. If left untreated, An infected abscess could potentially be fatal.
This is the ouchie bit. So most of that scratch has actually been healing up nicely. It's only a little abscess, which is good. Often you can get these huge abscesses.
I would hate to see a big one. I'd actually hate to smell the big one.
All right, here's the fun part.
With Harry's shoulder all clipped, Danny must now try to clean out the abscess wound with a saline rinse.
I'm just flushing it to try and make sure we get all the pus out. Otherwise it sort of stays in there. Oh, sorry, Harry.
Beaker.
Back at the animal hospital in Perth, Peter and vet nurse Katrina have been struggling to get close to a petrified mini fox terrier. She has a tube of superglue stuck to her side and a worrying wound.
Good girl.
I think part of the issue is that I am male and dogs sometimes find the bit of male energy a little bit too much and a bit too scary, and sometimes a feminine touch is a more appropriate way to handle them.
Come here. Come on, Lottie. Good girl. I know you're brave. Come on, let's go. Good girl. Come on.
Girl.
Oh, good girl. Come on.
Oh, lovely. Leave it to the expert. Yeah.
So this is Pete. Be brave.
Hey, sweet Pete.
It won't hurt you.
Are you a bit angry still? Yeah, you are.
It's okay. Shall we get you a muzzle?
Yeah.
That looks quite sore.
Looks like she's had a good chew at it.
It's got all teeth marks in it.
Yeah.
Before Peter attempts to handle Lottie, he needs to give her some pain relief.
Oh no. There we go. Done.
No.
Before I get to the super glue, I just want to make sure Lottie's otherwise healthy and well. I'm not going to look at your mucous membranes because I might lose a finger.
Good girl. It's okay.
Oh, I know.
Lottie, come
I
here.
know, Lottie. You need to calm down.
Oh.
Calm down.
It's okay. He's just listening.
I can't hear your heart properly when you're growling, Lottie.
Peter is going to use a solvent to try and soften the glue so he can remove the tube and hopefully ease Lottie's discomfort.
All right, so this is the product that we use to help break down glue. We normally use it on medical grade glue, I suppose, so I'm hoping that it will work on super glue.
If the solvent doesn't work, Peter will have to take more drastic measures.
We might need to get some more drugs.
Sorry, Harry.
Good boy.
In Melbourne, Danny is treating an infected abscess on her brother-in-law Jules' tabby Harry after a skirmish with a neighbourhood cat.
So why isn't that hurting?
Oh, I think it is. I think he's just stoic as anything.
Yeah.
He's just a tough...
Probably, you're probably right. He's tougher than I thought, and he doesn't like being touched. So the fact that he hasn't attacked us yet is a good sign. And to be honest, it's because he knows Danny. Sorry, Dr. Danny.
How are you coping with all this gore, Jules? You're right.
Not really.
Do we need a chair?
Part of me wants to take a photo, but then part of me never wants to look at the photo again, so.
With any abscess, it's really important that you don't close it over. You don't want to bandage it or stitch it up. You need it to continue to drain to release all the bacteria and inflammatory gunk so that it can heal up nicely.
With the wound successfully cleaned, Danny administers antibiotics to help prevent further infection.
God, he's tough.
He is a tough soul.
What'd you think, mate? The hardest part was just catching you and putting you in the cage at home. He'll be happy now. He just needs to get home, chill out, relax, watch some TV, probably fight with a neighbour again, show off his battle scars and get on with what he does best, which is sleep. That was a lot easier than I've ever seen a vet visit.
Oh, good.
Yeah, like look, all the skin on my arm.
We're all intact.
We're intact.
Good. That's how we like it. Good job, Harry. Hey? Jules and Harry are quite a pair and they both love each other so much. And with them around, there's no shortage of entertainment. See you later, you two.
Thank you, Danny.
Thanks
That's
for leaving this mess for me to clean up.
Yeah.
Keep out of mischief.
Me or Harry?
Both of you. Ready?
Three will go up on the table. See if we'll have any more like that this morning. Good boy.
At the Coleroy Plateau Vet Clinic, Kahu is about to undergo surgery to remove a suspicious lump above his right eye.
Yeah, that's the lump there that we're going to take off. It's a pretty nasty looking lump, isn't it? You see that?
Yeah.
Rubbing on the eyeball there. When I look at that lump on Kahu's eye, it looks like a cyst. It's a fairly common lump, but the size of that lump, there is always a chance that it could be something nasty. All right, Kahu, there we go. There he goes, breathing nicely. That's nice and steady, fantastic. Let's go for it. We're going to remove a wedge from Kahu's upper eyelid. By doing that, we'll remove the lump in its entirety and then actually stitch those two edges back together.
It will be a delicate procedure. Lewis will have to be careful to remove the lump without damaging the eye.
Here we go. Certainly wouldn't have wanted to wait much longer because the surgery definitely gets harder. The bigger that lump is we need to take off. Just making sure we're going bigger than the lump itself. You always try and take more than the actual lump, just in case it does come back as a cancerous lump. The best chance of curing Kahu is to remove more, and therefore we won't need to go back in and reoperate. There we go. That's a solid lump we've taken out there. Very happy that I've got rid of all that lump. So we're going to get this off to the lab now to test it and make sure it is just one of these common cysts and also rule out anything nasty.
With the lump removed, Lewis can begin reconstructing Kahu's eyelid.
This is the fiddly bit of the surgery now, just making sure we get these eyelids nice and lined up so that he's got no issues blinking once this wound heals. All right, Ash, I'm pretty happy with that. Little limp and tuck for the old boy. None of those sutures are going to rub on his eyeball there, so we're good to go.
With the surgery now complete, Kahu will spend the next few hours sleeping off his sedation.
I think that went well. Managed to take some good margins around that lump and the eyelids have come back together. But we're not out of the woods yet. We've certainly got to wait on those results from the pathologist. I'm really hopeful it's a benign cyst, but unfortunately there is a real possibility that it could be a cancerous growth.
At the Animal Emergency Service on the Gold Coast, Nathan and Natalie have brought in their German Shepherd cross, Ralph. He's had a nasty encounter with a fishhook.
Are you guys all right to bring him through?
Yeah.
Okay, all right, yeah.
All right, come on, Ralph.
Let's go, Ralph.
6-year-old Ralph has a fishhook caught in his tongue, and they're hoping Dr. Alex Hines can remove it.
He's obviously licked the hook because the hook had no food on it.
No.
So he's licked it, but in licking it, he's caught it in the left side of his tongue. So we could see where it was, and it hadn't gone all the way through.
Thank goodness he didn't swallow it. That would have been a whole different story. Yeah. Hey, Ralph. But it's obviously irritating him because he keeps trying to lick it. For Ralph to get a fish hook through his tongue, that must have been so painful. Apparently, he let out a huge yelp, and I don't blame him. It's not a great situation, but yeah, it could have been much worse if he'd swallowed it. What I'm going to do for him is I'm going to give him a little bit of pain relief, and it'll also act as a bit of sedation as well, because he's pretty anxious here now.
He's an anxious dog anyway.
Is he?
He's on tablets every day.
Yeah. He's on a plan for anxiety, basically, in dogs.
Takes anti-anxiety medication every day.
We'll work out a plan of how we're going to get that hook out of there.
It's all right, Ralph. You'll stay here with us. You jump in. Jump, Ralph.
Ralph is like, I'm not moving. You're all right, Ralph. Good boy. You'll see Mum and Dad soon. It's okay. Good boy, Ralph. I think we're going to have to go very slow and steady with this boy because he is just anxious. And look at him, he's just looking back for his mum and dad.
Super anxious, aren't you, Ralphie? Hey?
Oh, that's got to hurt. It's hard to actually tell whether it's gone through his lip or it's actually into his tongue because he keeps moving around. It could have been much worse. If he'd swallowed the fish hook, we'd be trying to get it out of his stomach. The fact it's in his lip, this isn't a great day for Ralph, but it could be worse. All right, well, let me get him some pain relief. Yeah. Give him a good dose, because he's going to need something. He's a very worried boy, aren't you? You're a very worried boy.
It's all right.
Good boy. Doesn't hurt nearly as much as that fish hook, does it? At this stage, the plan's probably going to be to get Ralph nice and sedated, and then we're going to need to try to remove it, probably with a pair of bolt cutters, actually, to snip through the fish hook and remove it. If it does go through his tongue, it's going to bleed quite a lot because the tongue bleeds. So we're going to need to control the bleeding, get the fish hook out.
There you go.
But he's probably going to need some heavy sedation. He's not just going to let us put our hands in there and pull it out.
We're being as gentle as we can.
In Perth, Peter is using a solvent to remove a painful superglue tube that's stuck in Lottie's fur.
We might need to get some more drugs.
But unfortunately, the solvent is not working.
It's quite nasty. It's so matted.
The whole hair is glue.
For Peter, Lottie's predicament brings back an unexpected childhood memory.
I accidentally superglued my mouth shut once.
What?
I was trying to get the lid off. I can empathise a lot with Lottie. I've actually been in a similar situation myself where I accidentally ended up supergluing my mouth shut. I was very panicked. However, after a few minutes, my saliva ended up eating away at the superglue and I was able to open my mouth and talk again.
Oh, I know.
However, using saliva on Lottie is not an option tonight. Now that I've given Lottie some pain relief, I'm going to try clipping some of her fur.
As if we can get past.
If we can get underneath that bit of chunk of glue, yeah.
Oh, this might be starting to work.
Lottie's clearly very upset with what I'm doing.
Oh, you need to calm down, Lottie.
She's feeling pain.
Are we able to get a head tapper to her head?
Yeah. Maybe don't pat slowly.
I've just tried to clip the superglue away using my clippers and this hasn't really been a good success. Lottie's reacting way too much. And is way too stressed as well. Oh no, I'll leave that. Lottie's obviously in a bit of pain and the superglue's actually come out from the packet and gone all through her coat in this area here. So there's a big mass of hair and glue that I can't get the clippers behind. It's too firmly attached for me to do with her conscious. She's clearly quite distressed. So the next step would be to anaesthetise her so she can't feel this and she's a lot more calm. And that way I can be a little bit more aggressive with removing this, this tube. But Lottie's a little dog and it holds a high risk.
Hello, Kahoo. Hey, how you going there? Oh, you feeling a bit sorry for yourself, are you, mate?
In Collaroy, Kahoo's recovering from surgery to remove a nasty lump from his eye.
You want some chicken, do you, buddy? Good boy, hey?
The big old lab's worrying eye lump is gone, and he's already regained his appetite.
Oh, was that all right, mate? You made short work of that, didn't you? Hey?
Devoted owner Michael arrives after an unusually quiet morning at home without his much-loved 10-year-old.
He's a crazy dog. Yeah, he's lovely. He's really good with us. Loves our place, so he just runs riot. Yeah, he runs the joint.
Let's go and show Dad your little eye lift, hey? This way, mate, hey? Who's out here for you?
Hey, buddy. How you going? Okay, buddy? Okay, it's okay.
He's happy to see you. Kahoo is a big softie this afternoon. He's been carrying on like a big sookie lala. The second he hears Michael come through the door, he's as happy as Larry, keen to go home and put his feet up on the couch.
I'm really happy with how it's come off, okay? And really happy with how it's gone with that stitching that eyelid back together. So it's now sort of waiting for results. We usually get them back in a few days' time. He's been a superstar of a patient today, haven't you, hey?
Okay, no.
Oh, I know, the collar's not fair, is it, mate?
How long's this got to be on for?
The e-collar's got to be on for about 10 days.
Oh, wow.
Yeah, so the last thing we want him doing is scratching at that. Yeah, absolutely, because it will be a bit irritating. So he will want to scratch, particularly as it heals.
I think I've actually got the easier job today. The surgery wasn't too bad, but poor old Michael's got to try and keep that collar on Kahoo now, which will be a lot of fun.
I'll obviously be in touch once we get those results, and we'll keep our fingers crossed for some good news, and we'll go from there.
Okay.
All right, mate. Hey, you're done. We'll get you home.
Good boy.
He deserves it.
Thanks again.
Cheers, Michael.
Take care.
Have a great afternoon.
Let's go. Good boy. Good boy. Okay. Good boy. Good boy.
Hey, Ralphie. It's your turn, mate.
At the Animal Emergency Service on the Gold Coast, 6-year-old Ralph has a fishhook stuck in his tongue.
Oh, good boy. Yeah, I don't know quite how we all go on this bench because he's a bit of a worry wart.
The German Shepherd Cross suffers from anxiety.
Good dog.
So he'll need to be put under a general anaesthetic before Dr. Alex and vet nurse Lee can start trying to remove the hook.
At the property where Ralph lives, he looks after the ducks, the chickens, the geese, even the kids. He takes his job very seriously. In fact, he's on anti-anxiety medication because he's just constantly on the lookout. He is such an anxious boy, they really want to have him home tonight. Yeah, okay. Because they just don't think he'll cope with a night in hospital.
Yeah.
And even now, he
seems real stressed.
Really stressed.
You're okay, mate.
While Alex tries to calm Ralph down, it's a nervous wait for his owners, Nathan and Natalie.
He was in shock, but then he was bouncing up and down, like he was, what's going on? Why is it hurting? And then he would start crying, and then, of course, there was blood coming out of his mouth.
Good boy. There you go. Are we ready? Little sleep. Hopefully when you wake up, it'll be all gone. Good boy.
With the sedation taking effect, Ralph finally starts to relax.
He's taking a lot of anaesthetic, I think just because he's so wound up.
Yeah.
It's taking a lot just to get him to sleep. Okay. Off you go. Good boy.
Do you want to help flip now?
Dr. Alex has been debating exactly how to get the fishhook out safely and is keen to get advice from colleague Dr. Lachlan, who's done similar procedures in the past.
Ralphie's got the fishhook and it's actually in the tongue, but the barb's not out the other side. So I was thinking of pushing it through so the barb's out and then cutting off the barb.
That technique certainly does work.
Yeah.
I have seen that being used. In my previous job, I have seen quite a few cases similar to this. And one of the other vets out there showed me a technique which is relatively not so traumatic of having to push it through the other way.
Yeah, okay.
And sometimes it works pretty well. So I can't guarantee it'll definitely go to plan, but I'm thinking that usually it's always worked very well for me in the past. If you want, I'm happy to show it to you tonight.
Yeah, well, how can you describe what you do exactly?
Yeah, sure. So if we can imagine this is our tongue here, okay? And we've got this fish hook coming in through this point here. There's our little
that's pretty much what it is, which is, it's embedded in the tongue.
Okay, so either you've got to try and push that all the way through to the other side, clip it off, and then get it all the way out.
Yeah.
The other alternative, how I've sort of managed it, is essentially we get like a pair of either needle drivers or forceps and basically grab a hold of this section here, okay, with that, and then pretty much in exactly 180 degrees the other way, we just get a bit of suture material and we wrap that around this point here.
Okay.
And now, with this side, while we're stabilising this, we're going to pull very quickly and firmly
in that
the opposite direction the other way. And we see, for some reason, it just, with the barb hook, it seems to cause less trauma, and it can usually come out in a matter of a few seconds once we get it going.
Really?
Yep. Well, we'll see how it goes tonight if you're happy to give it a go.
Yeah, I'm happy to give it a go. And yeah, I've never seen that done before, but if that works,
cool.
Let's do it. Let's give it a go.
Excellent.
details down. And then
It's a busy day for cat cases at the Kingston Veterinary Hospital, with Good Samaritans Michelle and Caitlin arriving with a tiny rescued kitten.
She definitely looks like a little stray. I hope you went in the engine when it was moving. We were just at the local shopping centre, came out, we heard kitten distress. The owner of the car came back, so we coaxed her out and thought we'd better come in here and make sure everything was all right.
Look what just came in. Oh, hello, little kitten. Where did you come from?
The little stowaway needs an urgent checkup from Danny, with vet nurse Hannah helping to hold the lively kitten.
This kitten has been found inside the engine of a car. I can't believe that she's not seriously injured.
It's a silly place to be. It's all right.
You're all right. Hasn't been any signs of burns or any...
Not that I could...
Abrasions. Don't need to even check if you're a boy or a girl, hey? Because you're a little tortie. Straight away I can tell this kitten is a little girl. The reason for that is because she's got orange markings in her tortoiseshell coat, and only girls can create that orange colour. You don't have a name yet.
She was found in a Mazda, so we were thinking of calling her Mazda.
Oh, I like that, hey? Mazzy, hey? Maz? Yeah. Let's see if you're okay otherwise. Have a little look in your mouth. Often when strays come in, they've got injuries, they're all dirty, they're flea-ridden, they've got disease processes already going on, and she seems really healthy. All right, let's see how much little Maz weighs. Just over 1 kilo.
Very tempted to keep her, but on practical note, wanted to find out if it was someone's pet and make sure she was okay. And
let's see if you belong to someone, my love, hey? Someone would be missing you very much. No. No microchipping you, dear, hey? You've got a bit of feistiness in you, don't you, hey? Maz is full of beans and all she wants to do is play with everyone. Anything under your little paw? No. She's in fantastic condition considering she's a little stray, so she's been coping very well by herself. Thank you so much for that, Hannah.
That's all right.
All right, you take it easy, little Maz. Hey, hopefully we find you a home soon, okay?
Come on, Maz.
See you, sweetie pie. Maz is such a gorgeous little kitten. I'm positive we won't have any trouble finding her a new home. Bye.
Good girl.
God, look how swollen it is. That's nasty. Oh, that's going to be sore.
It's going to need a good flushing afterwards for sure.
Yeah.
Alex is intrigued to see if her colleague Dr. Lachlan will have a magic solution when it comes to safely removing a fishhook embedded in Ralph's tongue.
So how I'll get you to maybe hold it for me, because I'll probably get...
Yeah, you tell me what you need me to do.
Almost just hold the tongue for me like this.
Yep.
Okay, then I'll essentially have one hand on it here, and I'll be wrapping the other bit here, and I'm just going to go like that, the other way.
Not going to stick the fishing hook in my hand.
No, I don't think so. We stand in the right direction, it should be nowhere near.
All right.
I think it should be safe.
Okay. Yeah, cool. Let's do it. You feeling confident?
We'll see how we go.
Alex was thinking about cutting the hook, but Lachlan's technique involves holding the shank end firmly, while the curved end is pulled in the opposite direction, causing less damage as the hook comes out.
I'm really glad that Ralphie's asleep. I don't think he'd put up with this if he was awake.
No, definitely not.
This is not pleasant. All right.
All right. So, when I say 3, 2, 1,
yeah,
we're going to pull.
Okay, just a minute. Yep, okay.
You got it? And 3, 2, done. Out.
Oh my goodness. Look at that.
Down to one go.
Wow.
Now it just needs a really good flush because there's still going to be some nasty sort of bacteria in there, but you can see pretty easy with not too much trauma at all.
Really good.
Dr. Lachlan has managed to remove the hook cleanly, leaving the German Shepherd with a good chance at a quick recovery.
I'm so impressed. When Lockie first told me about this technique, I wasn't sure it was going to work. It sounded a bit dodgy, but sorry, mate, but I didn't know. I've never seen anything like that done before. Normally, we push the hook through and we cut the barb off, and basically in doing that, we're creating another hole out the other side of the tongue. But with Lockie's technique, we're able to pull it out, and Ralphie's only got the one hole.
If we can find an easier way to do things without more complications, absolutely. And it's worked for me just about every time, so I keep doing it.
Yeah. Good job, mate.
The next important step is a saline rinse to clean the wound and help reduce the risk of infection.
heaps, eh?
Yep.
Right. Cool. I can wake him up. All right. That was incredibly impressive. I can't believe he just pulled it out. We've got one hole. I reckon that'll heal up in no time. That looks really good. Hey, Ralphie, you go back to guarding your family. Ralph just needs a little bit of time to wake up. It's nearly midnight, but I've just heard that the whole family are coming down, even the kids. There's no way they were going to stay away. All right, back to bed? Back to bed. All right, come on, Ralphie, let's go.
Got to be very brave for this.
At the animal hospital in Perth, removing the superglue stuck to Lottie's side is turning out to be a marathon challenge for Peter.
It's a lot worse than I thought it was going to be. All right, sweetie.
Lottie, you're going to be brave. Good kill. Oh, well done.
Well done.
She didn't even feel that.
No, she didn't react to that.
Good kill.
The leaking tube of glue is so firmly stuck that Peter has been forced to anaesthetise Lottie.
Oh, yeah.
He has to work quickly to avoid causing her any more distress. Lottie's worried owner Jonathan is waiting out in reception.
I could recognise her whimper, so yeah, it was a bit difficult to hear. Hopefully she pulls through and there's not any serious injuries.
There you go.
Slowly give this drug until she gets sleepy.
Feeling a little bit funny.
Now that Lottie's asleep, I'm going to try and use a scalpel blade to trim her hair and remove the super glue. It's a little bit more risky than using the clippers because the scalpel blade's a very sharp instrument and I could easily slip and cut her if I'm not careful. I really don't want to have to sew her back together tonight. She's got a big wound under there and hopefully I can just remove this by shaving her hair.
But Peter has discovered that the glue is not only stuck to her fur, it's also penetrated her skin.
There's a lot of glue over her skin and it's extremely adhered to her. I'm going to try and just shave the hair and remove the super glue completely and hopefully that'll just be a quick and easy fix. It's just the first layer that's come off, it's not actually a defect.
Oh, it's sore.
It is.
I'm going to give her another 0.1.
I think I'm going to have to actually
surgically remove it.
It's really firmly attached to her skin, so I don't see many other options apart from actually removing a bit of skin with the glue as well. We'll keep trying to avoid that, but I'm a little concerned that if I keep going, I'm going to end up causing too much trauma to the skin and we'll end up having to do that anyway. If I don't have any luck removing this now, my only option is to go to an emergency surgery. I really want to avoid this. Lottie's a little dog and I don't want to have to put her through that.
Hey, Mr. Ralph. You're looking good. You ready to go home?
On the Gold Coast, Ralph has woken up after the fishhook removal surgery and he's well enough to go home.
The whole family wanted to be part of this reunion. Natalie put the kids to bed, set the alarm and woke them up so they could all come down tonight.
He's a lovely dog, absolutely.
He adores my family.
Come on. Come on, Ralphie.
He does his job in terms of protecting
He adores all the
He's
animals.
very good with the kids and that's all we can ask for.
Oh, hey, baby.
Hey, buddy, how are you?
Come here.
Oh, hello.
How you doing?
Hello.
I missed you.
It was such a lovely moment to see Aiden with Ralphie. It was Aiden's fishing rod that Ralphie got hooked on, and the poor boy has been so worried all day that he nearly killed his best friend. What do you guys think?
He's amazing. He's a very awesome dog.
It's all right, buddy. He takes cuddles and hugs very well, doesn't he?
He does.
Like these cuddles.
Very important. The centre of attention.
All that's left now is to take Ralph home so he can get back to work guarding their menagerie of farm animals.
Aiden, can I say goodbye to him? Yeah?
See you later, Ralphie.
Hey, be a good boy. Look after your family, because they love you very much. Hey? All right, you guys take him home?
Yes.
Thanks.
All right. Thank you very much.
See you later.
Bye-bye.
Yeah.
Thank you so much for everything.
No worries, Nat.
Another 0.1.
Yeah.
She's still reacting. I'm going to give her another 0.1.
Yeah. It's a weird location.
In Perth, Peter is still struggling to remove a tube of superglue from little Lottie's stomach.
I've never seen anything like this before. This is definitely a first.
Lottie's been anaesthetised in the hope that the glue can be removed while she's under sedation. The next step may have to be surgery. Peter is trying to work as quickly as possible to avoid keeping Lottie under anaesthetic for too long.
Just giving another 0.1.
I'm using the scalpel blade and it's not really working. Yeah. I'm gonna have to figure out another way. I've decided to use a different instrument called a forceps.
I'm just trying to gently use it to open.
Oh, that's working.
Yeah.
The forceps are doing the trick, but it's a painstaking process. And due to her small size, little Lottie can't stay under anaesthetic for too much longer.
Another 0.1.
Yeah.
She's still reacting. I'm going to give her another 0.1.
Yeah.
Blood pressure's dropping a little bit.
It's almost off now, Kat. It's just a little bit that's firmly attached right in the middle.
Blood pressure's at 71 and her heart rate's 94.
Thanks, man. Yay, it's off.
Oh, God.
Fantastic. It's off, it's removed, it's done. Oh my gosh, look at it.
Can we clip it and clean it?
Yeah, definitely, yeah. Didn't go initially how I thought it was going to go, but we got there in the end, and thankfully we didn't actually need to give her a full surgery today.
Some soothing antibiotic cream will help the wound to heal. And a stocking net will keep it protected.
It makes her look like a chicken roll. Come on, Lottie. Hello. It's amazing. We've managed to get this super glue off and I'm giving Lottie back to John. It was a little bit more difficult than I thought it was going to be initially. She has got a significant area of trauma to her skin there. So ideally we just want to keep this one over the wound area itself. This stockinet's just there to hold that in place.
She'll need a cone of shame as well.
And cone of shame as well.
Good girl.
We'll definitely make an effort next time to keep super glue locked away. Hopefully she's learned her lesson as well.
Come on, get into the park, mate. Come on. Come on, you can sniff everything. Hey?
As for Kahu, it's been 3 weeks since he underwent surgery to remove a lump from his right eye.
It's a nasty looking lump, isn't it?
Yeah, poor thing.
Lewis was concerned the mass could be malignant and sent it to the lab for analysis. His worries were confirmed, as it turned out to be cancer.
We were hoping it wasn't malignant, definitely hoping it wasn't malignant, but it was.
How you going, okay?
But I thought it was good news, and Lewis got the margins, got out right around it, right outside it, and so hopefully that's all done and dusted, it'll be gone.
Today, Lewis is keen to find out how the 10-year-old Labrador he's known for years is recovering.
Hello, buddy. Hey? Hello. Hey, you excited to see me, big boy? You're silly enough to still enjoy seeing me, aren't you? Hey, there you go. So, how's he been?
He's been good, yeah, he's been pretty good, yeah.
The eye looks fantastic. Really happy with how that has healed up there. And once they get the e-collar off and the stitches out, they're obviously a lot happier, aren't they?
Definitely happy now, yeah, real happy.
Fortunately, during the surgery, we sort of removed all the tumour and some normal sort of tissue margins. So that gives us a maximum chance of that surgery being curative and Kahu not having any problems from it down the track.
Are we still mates? Yes.
And it looks like Kahu's back to causing trouble at the park, and probably the most important thing is it looks like he's forgiven me and we're still good mates. So really happy to see that because he's a gorgeous old boy.
Well, it's forgiven, isn't it, buddy? Hey? Hopefully the future's good for him, mate. He's just full of life, he's so happy, loves everyone. So yeah, we've had 10 great years with him. We want many more.
Yes.